Yeah, it looks like you're the only one online.
Sonia's
Tanya.
Sonia's on too.
Okay, that big thing in the middle of the screen, I got it.
I think that'll work. Yeah,
We needed to have something.
I agree with you.
Yeah. I like it.
Well, then, Rick is showing the non-fraternization policy. Are you ready?
Yeah.
See? Okay, let's call the meeting to order. It's 10:10. And hopefully we can get through this pretty quickly as we can. Rick? And we do have a quorum, correct?
Yes. Because we're only missing Tiffany and Braga.
Well,
And then, right, she doesn't vote.
Yeah.
Terry doesn't count, right?
I completely forgot my laptop today.
No worries.
Employee files yesterday, and so,
No worries.
but there's not much change on the treasurer's report from what I reported on Wednesday.
Not that long ago. I would just say that before the next meeting, if you could just work with Carrie, what you always do. So always, I'm not worried about it. Anybody else have any questions? I do want to look at the calendar really quick, guys, before we get
Okay.
too deep into the swing of things. I just want you guys to know that I'm going to be out on so we're not having a meeting on Thursday, right? Our board
No.
meeting is canceled on
I wanted to
the
do-
22nd.
Doing all this.
Okay,
Because I have a.
so next month's board meeting, I'm having carpal tunnel surgery on the 25th, so I could probably attend. If we're doing a board meeting on the 26th, we could probably attend by Zoom, or we could move it to the next week, which is July the 3rd. So what would you guys like to do?
What day is July the 3rd?
Thursday,
Which means,
It's
We
the
could-
day before, that's the problem, it's the day before
4th of July.
July. I mean, honestly, I think, in my opinion, do it the same day and then you just jump on it Zoom, and if you can't do it, then
I can run.
Miss
Yep.
Jen
Okay.
can run it.
Okay, and then,
We can just reverse roles.
yeah, no, I'm okay with that. I
That's
just
how
want
it
to let
doesn't
you
affect
guys
your grades.
know that it's also.
I'm glad you're finally having surgery, Val. I am very, very proud of you.
It is overwhelming. There's another date, but I think I can do it at next executive meeting where.
And while we're on calendar, I will be out of town for the regular health council meeting in July.
Okay.
Depending on what's going on, I may be able to Zoom, but I'm gonna be up there for my sister's wedding, so. She's the last man standing getting married, you know what I mean?
Congratulations.
So I'm gonna be there that whole week.
Okay,
So if there's nothing going on and I'm bored, I'll hop on, but
so
most likely not,
Then
because we have a whole day that day planned of sister things.
oh, I love it.
so you're not available when, and you're not available when?
Next board meeting for me.
Mine's the next in July, the regular health council meeting. So right, like after the 4th, that whole next week, I'm gone.
So July 13th through the 19th, we have our NACBSO training. I'm not going to Kentucky anymore, but we will be on that. And then the second week of August 11th, we've got to be up in Albuquerque all week. So I think that falls on,
I think that is that's fine now. As long as you get your update to Carrie,
yeah.
then it's all good for that.
What week was that, Dan?
So this July 13th to the 19th. I'll be out of pocket for training,
It's the same week Jen is out, right?
and then it's August 11th, with August 11th.
The 19th is whenever we're doing the QPR.
That's a Saturday though, right? Yeah, I'm gonna be home doing training.
No,
I'm
that's
just-
hers is
yeah.
the week after. I'm gone.
Send all of this to me in email so I can
Week of 7th.
see calendars and set stuff up so I know where it's at. Okay.
Okay. Any other calendar stuff? Okay, so let's look at the employment contracts.
And Dan and Sonia, just so you guys know, in the, whatever that chat is that we have. Yeah, base camp, I put in there a no fraternization policy. If you guys could just real quickly look over it, so that we can potentially add it to the employee handbook.
So the last time we met as a board, we went over this page by page, paragraph by paragraph. And I wanted us to take another hard eyes on it before we go into June and get ready for July. So what I need, I guess, is if you guys approve of the handbook, I need a vote or any discussion regarding the handbook. And I guess the no fraternization policy, if we agree on that, I think we need to do that first and decide where that goes. I think previously it was on. Where did I set it?
Oh, it is
Employee-
highlighted on page 11
11, okay,
at the bottom.
okay.
Carrie mentioned that this is probably something that needed to be different or taken out, just because a lot of us do have outside relationships. I know Carrie goes to the,
I have relationships outside of the health council with several board members. And the way this is written is that technically I can't have those relationships. But I also feel that whoever, the director needs to build relationships. And so whoever's in the position at some point would have different ones. However, it also needs to be so that those relationships don't interfere with the board operating as well. Which can happen when you fraternize, but I try to fraternize with all of them.
So what Rick sent, the non-fraternization policy is, the purpose of this policy is to maintain a professional and respectful work environment that supports our mission and values. While Chaps County Health Council recognizes the importance of camaraderie and positive relationships among employees and board members, it is essential that these interactions do not interfere with work responsibilities, decision-making, or the integrity of our organization. And then the policy statement is therefore, I think that this probably fits the needs. I'll let everybody else read the rest of it. It's in base camp. But I think that this is gonna take care of what you just said.
Yeah, I think starting in that.
You agree?
with that one.
yeah, that one works perfect to replace the no fraternization.
Do you agree? Do you-
I hope so, I
Sorry, Dad. What do you think of that?
I think it's good.
Evangelina?
Yeah, I mean, I agree with what Cory is saying. I mean, it's kind of hard. Not to, have kind of relationship, you still, as long as it doesn't like interfere with your decisions, like, to,
And that's what this rewritten policy says.
so yeah, I'm good with it.
Okay. Dan and Sonia?
Yeah, I read it in here and I think the same thing. It's very specific and detailed, so I like this one.
Thank you, Dan. Sonia?
I agree.
Thank you,
Looks
Sonia.
good. Yeah.
Good. So it sounds like everybody would like to, and I'm just gonna do this, motion to adopt what Rick wrote and replace what was currently in the employee handbook as the fraternization policy, non-fraternization policy. Do we all agree? Say aye.
I
Anybody does not agree? Okay. We can put that in there. In lieu of that, how does everybody feel about the handbook as a whole? And has anybody had an opportunity to review it as a whole?
did,
I think it looks good.
me and Carrie worked on it together.
Love it.
And then after we did that, I took it and ran it through chat bots to clean it up and shorten it up.
Ran it through AI.
Yeah, because I got from 28 pages down to
Yeah.
18.
No, I've read through it, and I think that from what I'm seeing that we're covering everything that we should ultimately cover.
Dan?
Yeah, I love it. Got it in the email and reviewed it. And I'll definitely say that I'm stealing it for my employee handbook too and making some, so it's really good.
Happy, if Dad's gonna do that, hey, let's do it.
One of the things that wasn't in here, and this was a shower moment, was travel policies. Should travel policies
Keep us up.
give them separate?
Well, and that's one of the things that we're gonna ultimately be. That's one of the fun things we get to start working on is going through all of the different types of policies.
Yeah.
that We're going to need to start officially writing. This is just your guys's policy.
For employees.
Yes, now we're gonna have to, and you and I, the four of us or whatever, can sit down and I can show you a list of every policy we have. We can start going through and pulling and saying, oh yeah, we need that one, yeah, we need that one, yes, we need that one, or those sorts of things, because. We really do need to set those policies up, to make sure that as an organization, we're setting ourselves up for success.
Okay. Should we schedule a time to meet for that, or?
I think that would be a good thing.
It'll go by the wayside how busy we
Yeah,
are.
no, we're gonna need to schedule something, and. We ultimately need to do it now, if we don't get it done, I don't, until August, I think we'll be okay, because I don't think anything major is really coming up in June and July. And stuff, but we definitely, within the first couple months of this next fiscal year, need to sit down and say,
Okay.
these are the
We
policies.
wanna just say that we can maybe set something up after the expo, cause that'll kind of have some stuff off of mine and Carrie's plate.
Works for me.
Works for me. Okay, so let's not forget that, job descriptions.
Okay, so my intent was to go ahead and just like throw some quick things together to mull over, not to actually vote or decide on, but because I think it'll change a little bit. However, this was a horrible week for me. And so while I've got some printed out to start looking at, I don't have anything put together to actually talk to, but I figured bring it to the board. Do you want me to kind of put stuff together based off of our scope of works? And what I did was I looked at different
That's all I did.
organizations.
That's all I did whenever we put out for hiring for both the CHW and the director position, was I just pulled from scope of work. And condensed it down a little bit.
Yeah, and what I did is, like, I looked at other health councils throughout the state. And saw what they had online and was gonna start reading through that to see things that maybe because I think I do a lot more stuff that's outside of the scope of work. That may need to be put into a contract, and just like I think the community health worker. 211, however that piece is gonna look, I think needs to be kind of adjusted and set.
Well, and there's a phrase that should be at the bottom of both of these. Is any other job duties as assigned. We just need to automatically have that in there.
Yeah.
I
So-
think it is in-house contracts.
I'm pretty sure there's something in there that's close to that.
I think we tried to add it on every.
Yeah. Yeah, I think if it's something though that's something that's just like a normal part of the day-to-day stuff into it.
Mhm.
Like, it should be on the directors to work with the budgeting pieces. And I didn't see that necessarily in the scope of work. So it's like things like that. Some of those things need to be adjusted or changed. Sure.
Sure. So do you want to move? Continue our Jen, I guess, job descriptions on the next board meetings agenda. So we will definitely need to solidify the job descriptions by the end of June, so this has gotta be. Done by the end of June, right?
So can I ask then, can we get the job descriptions out about 2 weeks beforehand? Just to give enough back and forth
I agree.
before we officially get to, because if not, we're gonna spend 90% of the board meeting. Just going over job descriptions.
Yeah, honestly, I'd like to see if I could get something with it by the end of this week.
Perfect, but if you can have something done by the end of the month or the second week of June, that would be. Perfectly.
At least to have 2 weeks before the next board meeting.
Yeah, that's not a problem.
Sounds good. Any other discussion regarding the employment contracts moving into hourly employees? Is there anything else we need to do to proceed to hourly employees? I think we talked in depth the last time we met about talking in, about timesheets, about payroll, about all the, is there anything we need to do?
Is Betty aware?
Yeah, and Betty.
Cause I know that she'll have extra things that she has to do, so what is that gonna look like on her cost wise?
So that kind of falls more into the budget piece to it. So the email that went out to Betty, she said, she's not really sure what fee would come out in order to get this all set up. We have to get a CRS number, we have. Set you up on their tax system, we are. And to pay withholding tax, workers' comp fee, we'd have to get an employer ID number for the Department of Workforce Solutions. That shouldn't take anything, because I think it's already one of the numbers we have, but. And so they can do the SUDA taxes. Everything else is there, we pretty much have most of this done. But then I went and I pulled the engagement letter from May Taylor that they had submitted, and the proposal includes payroll stuff.
Yeah.
So
Already paid.
we've got what we're already paying, so this would just be the additional pieces to it, so.
Perfect. Now, before we dig too much deeper into this, and it's just forgotten in general, I do want to put this out there. Carrie and I were talking a little bit yesterday because, she had some questions about the budget just in general. And it got brought to my attention that ultimately, if we don't approve her to finish off the year, our budget for her ends about the middle of June.
What do you mean?
I'm about 100 hours over on my contracted time.
I'm not following.
So we budgeted. Can we bring that up really fast?
I
Thank you. I just don't want us to forget this piece and have it come to a. We're rushing on it scenario. So, we had budgeted a specific amount for her position
Is that the right?
and
Well,
Close that. So you can see.
wait, no, I just gotta get closer. Sorry if you guys are looking at me weird, please don't. Don't judge. Okay, so my total contracted hours is 2,112. Right now, I've done 1901. Holders.
I thought we just given you an entire budget, entire sum.
It is, but that salary is based off 40 hours a week, 8 hours a day. So, and that's why I'm tracking it this way. Because. Shit. Sorry, we opened up all this other stuff and now I gotta find everything.
Oh, thank you. Yeah.
I didn't realize my eyes were that.
So, so my contract amount is 45,760 to date. Right now, I'm at 43,650.
Okay. So
And we know that,
what's the problem though? I mean, I think we have.
we know that between now and the end of June, I will have a payroll over 2,000.
We'll
we just need to approve her to
Okay.
moving forward. Is all we need to do. I make a motion to continue.
I second.
Any other conversation or discussion? Dan or Sonia, do you have anything to add?
No, this is just to make sure that we're staying within that. So no, I can vote yes on that.
Any other discussion about it? Okay, all in favor?
Alright,
Anybody who? Anybody not in favor? I don't even know what that word is.
opposed?
Okay. Hearing none, motion carries. Sorry, but no. I'm just gonna leave it alone, because I don't even want
I
to.
don't think that we budgeted in any possibility of overtime.
Oh, okay,
Yeah,
I'm okay with that.
and I keep trying to cut my hours and it's just, it hasn't.
No, and
I'm trying to.
Yeah.
everything that's gone on, everything that we're doing, like, it's bound to happen. There's gonna be some overtime, so we probably need a budget.
Oh, and I already talked about it. Part of the budget is already her, with overtime, and my proposal to add to it ultimately is gonna add a little extra just in case. So,
Okay, So are we ready to go into budget? Because this is kind of the bulk of our conversation today.
We
Do
want
need a
to
break.
just skip that and do the rest of the agenda and then hit the budget at the end.
This is why I love you, Jen.
I tried to put the budget at the end and somebody moved it.
Okay.
Well, it's because you were going into executive session, so I was like, okay, we'll kill everything.
We're going into executive session today?
Yes.
Yes.
Oh, okay,
Okay, so let's.
No.
not right now.
Not right now,
Not right
now,
Sometimes.
not right now, but if we need to, we can have them step out for a minute and not record it.
Okay, so let's do part F in the agenda. Grant applications, Carrie.
So right now, we've got 3 outstanding grants. I've been working with the New Mexico Falls Prevention out of the state thing to try to get something. We've been working on different ways of working grants out. This is our second proposal in it. So they're really trying to work with us to get something here in rural New Mexico, so Chaves County, because they've been told they have to work outside of Albuquerque. So I think I ultimately will get something in here. We're just not quite sure what it's gonna look like. So working on that one. I've had the emergency food and shelter program, that's a federal one. That is on hold, but as soon as that comes up, this is money that goes through, the Roswell Refuge, and it's distributed out to like, the community kitchen and harvest. It's food and emergency shelter. Our biggest call we get for on 211 is I need housing or hotel assistance. We don't have hotel assistance. So when this comes up, that will be my ask, give us money. And when we get the 211 calls, we can actually issue out hotel vouchers.
So they're not gonna so I'm sorry, you don't, so vouchers the police department no more?
They'll do one
One.
only, and you have to meet very specific guidelines and
Yeah.
regulations.
And plus the kids, we have the Family Resource Center where we have them paying some housing, hotel, and then we have the keeping families together if they're unhoused completely, then they can do that. So
And then with
there
that,
are some referral sources in the community.
Yeah.
They do have to do a little case management, which isn't, I mean, for a hotel.
And usually the way this is working is we're getting the call because there's a domestic violence situation and the shelter's full. And so they need a housing voucher, and for some reason RPD's not working with them or something. We went kind of through this with another organization that was doing it. And so this would help alleviate some of these problems.
Okay.
So yeah, there's a lot more to it, and we'll just be willy-nilly handed out, but we'll work through all those details. Should it ever come available?
I hope so.
Yeah. But since it's federal,
This current administration is not gonna.
Yeah. United Way, my ask was 40,000 to fund 211 program, and you'll see that it actually is now a program on its own in the budget because I had to budget it out. I have met with the new director. I did our pitch to United Way. I don't think we'll get the full 40,000,
never do.
but I think we'll get more than 5 just because, well, I know a lot of people on the board.
Well, I mean, you deserve more than 5,
Yeah.
do it today.
Yeah,
It's something that they're supposed to be running. And they're not, so give us the money.
and one of the things is, the gentleman from Christchurch who's on their board says that 211 did a fantastic job during the fire and floods.
Yeah.
So they saw what we are capable of doing, and so it'll flow. I don't think it's gonna be a problem with the funding on the 211, because if we ever get the opioid stuff settled out, that will pick up some money into that, because there's a whole piece in that funding to help pay for the 211. And it changes a little bit of the scope on the 211, only in the sense that it adds another layer to it, but it's completely doable. And that'll help, and so 211 will ultimately become funded out, so I think we'll be good.
What I would like to ask the board, and you, Carrie, but I would like for us to have a better idea of what 211's responsibilities are and what the job looks like in a day-to-day setting. Because I think one of the things that I continue, and I'm just guilty of this, is that I go back to when we first started. and I've lost touch of what we have to do now, right? Or what's best practice for 211 now? Because what you just said about tying what is happening for phone calls now into grants is vital. But if we're not practicing to try to capture that data or to try to be able to match that data in a way that's meaningful.
Can you show us
I'm going.
Well,
emails.
and so. Boys and Girls Club put in for Chavez County funding like we do every single solitary year, and we had 10,000 less than what we got last year. And one of the big pieces that came up when I was talking to somebody about it is, fiscal responsibility is extremely important across the board when it comes to governments in general, especially the, who we have running our country right now. From top to bottom, fiscal responsibility is extremely huge. The more we track what we're doing and the more we prove where our money is going, the more likely we are going to get funds from other organizations. So this is where it's going to be very important that we are paying attention to every detail that's going on. If we get United Way, if we get $5,000 from United Way for 211, we need to register where that $5,000 is going and how we spent that money, so that next year when we go to them, we say, hey, look, this is what we spent that money for, this is what we really need, and we can really pull more money from it. But I see it happening on Boys and Girls Club side. Fiscal responsibility is going to be what's going to get us more and more grants and more funding across the board. And proving that fiscal responsibility is the biggest key.
Okay, so you hit the nail on the head, saying it in a way that makes sense, that we're trying to help 211 grow. We're trying to help 211 be an official legitimate program. And so it's exactly where my mind is, but again, like, we're also busy, like, we have these meetings and we move on, and Carrie's left holding the bag. What I want us to do is be very well aware of what this is about, and so that way we can support you in any way we can.
So this here, it's a Google sheet. This is what is on our cell phones. Anytime anybody calls, this is the document automatically that we're supposed to go into. This is also where I'm tracking the monthly stuff. So when we go to the board meetings and stuff, here's where the numbers are. So this is. Thank you. Oh, perfect. Okay. So, and then here is the resources that were vetted out from last year. This is where I keep saying that it's really hard for me to figure out who does what. Most of the time, I have to do that and then do a key search if I am looking for a utility. And minimize that. There's 4 utility sections in here. That one's utilizing, that's not what I need. That one doesn't include utility payments. Case management, Alianza helps with utilities. Okay, so there's one option. And then my last option is CAP helps with utilities. And that's how we find it. So when I say that I'm looking for detailed information on this 211, this is how we have to find it. We got to go with these taxonomies. We got to be very detailed as people are telling us what they need, because they don't know how to ask for it. We have to find those keywords, and everything is those keywords. So then that's last year's resources. This is what we're putting together with the Survey Monkey that's going out. And so this is how it's coming across now. So if I look here at Casa Kids, there's their information, and this is the shortened version because there's a much longer version of this. Dan and I worked really well together to come up with this one. So then there's the phone numbers, the contacts. But then here, if it says utility assistance, we will find it and we'll pick it up. But if it has something here, preventative program to help families by connecting to community resources for basic needs, financial assistance, mental health services, and more. If I did utility search, that's not going to come up. Right. And this is what you would tell the general public. This is what we do. This is what my program is. That's not what you tell me as a 2-1 worker. I don't need your PC versions of stuff. I don't need your fluffy words. I just need, okay, we do utilities, we do housing. If you are a parent of kids from 0 to 3. I was in a meeting, Sarah was talking about a program that works something with families if they have kids with 0 to 3. And what program was that? Because I don't have anything that has age limits, because we ask them when they call. We have the call log. And this literally is when you call into 211,
That's what you're getting your data from.
this is where we're pulling our data.
Is there a way, when you're vetting the 2025 resources, is there a way to have a check mark box for those keywords that you're looking for? Housing, utilities, water.
It's in
rent?
the taxonomies.
But is there a way for like anybody to check mark it? So you do your PC, but you check mark these keywords and you put the keywords and
Yeah, the ones that you need regularly, like housing assistant.
if
utility
this applies to you,
assistant.
just mark this box.
Yes,
No, I kind of skipped some of that because based off of the way SurveyMonkey is set up for the membership. Application is weird and wonky and I get weird stuff in there. It's hard for me. I'll look at it and see how I can do that because we've only got 30-ish people who've done the SurveyMonkey on it in the vetting. And then when we're actually doing the phone call vetting, which is where our intern will work, she'll go in here and she'll start going and she'll use the SurveyMonkey to enter on it too.
I think it's fine, and maybe she could just have a check mark box on her end and say, do you do any of these things? And is there any other, after you do a list, it may generate their minds to say, oh, we do. Blah, blah, blah,
Right.
transportation, we do, you know,
Yeah, and that'll be something when I'm talking with her, because I'll have to show her and tell her exactly how this program works and what I'm looking for. But yeah, that was something I gotta change that. Detail piece to it, and I'll look, if I can figure out how to make check boxes work in it and get the data. The way I need the data, but the way I see SurveyMonkey, if I have a checkbox that says utilities, it's a column header. And it just has something in it, and it's still not gonna give me the information if I did a control find for utilities.
well, after you do the check mark box, after you've done your call, SurveyMonkey call. You could gather all of those words and put them in your,
Yes, whoever is dealing with 211 should be able to do that. Can Carrie handle all that with everything Carrie has going on? No, I cannot vet 211. I've got way too much going on to be able to handle this. So, I mean, yeah,
How long do we have the intern?
I got her June and July. And she does come from the blind school. And so that's why everything has to be done in this, because you can't work off paper, because nothing we have is in braille. But her computer system will read to her and she can do phones. And so she'll literally be calling them and going through it and putting it into the computer.
okay.
But yeah, this is where we get the information and it breaks it down. I think I'm gonna have to add a Texas 211 because my God, we get a lot of calls from Texas 211.
yes.
And then if I'm in my computer, I will search the data for us.
Their 211 is income support or something like,
Texas?
yeah, it's
Yeah.
like the border.
Yeah,
If you go to it, you'll see the signs that say
Yeah.
211.
Yeah, their 211 is different. The,
So,
what
and
ours
that's
is,
something that I was asked was, cause I've been pushing 211 at work, you know? And they're like, okay, well, is this gonna work like all over? So if they just push 211, is it gonna be directed to somewhere else? And I thought, my understanding was that it's where the area that you're in.
it's location based.
yeah, but the
thank you.
thing is,
It's-
if you,
Yeah,
but
if they're here and they're trying to call Texas 211, they call 211, they're getting routed to us. That's where the problem comes.
I think
Because they
reverse
don't know
too.
that it's location.
The
based.
reverse too,
Yes.
people,
if they go to Lubbock and they're from here and they call 211, it's gonna route it to Lubbock's 211. So that's where the.
Area.
Exactly, it's not the area,
where you're at,
it's the towns.
your location, your specific location.
Yeah, my phone says.
So say somebody from Texas is here and around in our area and they call 211, but they're calling for their home in Texas, they're getting us. They're not getting their.
Okay,
And they think they're getting theirs because they don't know it gets rerouted.
okay, seeing that, I didn't understand. Thank you very much for explaining.
Yeah, it's kind of happens both ways.
Yeah, but all 211 centers have access to be able to either find the information that they're looking for or find their hard line numbers and say, here, you're gonna have to call this number instead. I can't find that information for you.
Okay. So that's why when they call, when we are advertising 211, we should always advertise not only 211, but our office line. the 575,
The 910, the cell number that goes with it, because you can text the cell number and it'll kick it through.
to us as well.
Is that the app that you're?
Yes, and I can get that set up on your phone.
Yeah,
But yeah, we've discovered that, so, VoIP phones, the internet-based phones cannot call 211. And that's where they get the busy signal on it. It's because you have to go to each individual VoIP phone provider and they have to release it because I guess it's not done on a national level like 911 or 988 even. And we just don't have the capacity to do that for every VoIP provider here. So we'll just have to let it go. We'll talk to the New Mexico 211 group and see if I can get them to make that a priority, because I don't know if they know that doesn't work. Or it could just be isolated to us and then we have to figure it out, but I will get with them and we'll address that issue.
Okay,
But
I
so,
love that. This is what we've wanted for a while.
100%. Yeah,
right, and here's where they received prior services, because we have to know that. Have you already talked, you need utility help? Have you called the CAP office? Well, yeah. Okay, well, I can't send you the CAP office, you've already used it. And if they've already called every single person that we have in our list, I'm like, I'm out of resources, I don't have any help for you.
yeah.
And that's the worst thing to tell anybody. And I will tell you this, it was a Saturday, I had left the soccer field. I wasn't gonna answer the 211 phone because, we're not supposed to be 24/7. So I was doing my due diligence, I wasn't gonna answer it. But on the fourth call, I went ahead, pulled over and answered it because I was driving. And he was in crisis mode. And it was homeless and he lost his job and he was needing all kinds of services, but nothing that could help him right then and there, which is the thing, is there's no help on the weekends either. And so I was on the phone with him for probably 40 minutes. And it was like, okay, maybe we need to get some 988 help with you. Maybe you need to go over to La Casa. He was trying to get in shelter. So I'm like, go to the Homeless Coalition. He was right there by the shelter, but nothing was going to work for him. He was spiraling. By the time we were done, there was still no help for him, but I think he wasn't spiraling as much. Now, am I qualified to do that kind of discussion with somebody? No, not by any means. And so I have to be careful what I'm saying because I don't have those skill sets. As we're going into a 211 person, they need to have those skill sets.
Well, yeah, and I was about ready to say that might be something we need to really start looking into. Is potentially getting trainings done for our 211 operator who has even basic skill sets to handle a spiral like that. Because if not only are we going to have a spiraling person on the phone, but we're going to have an operator who's spiraling as well because they don't know how to handle the situation. Because I will tell you, those get extremely overwhelming and extremely stressful very, very quickly when somebody is spiraling and nobody knows what to do.
Yeah, well, and I can tell you from the flood, I spiraled because I had one lady who would just not stop and harass me for I don't know how many days because I wouldn't drive over and check on her ex-mother-in-law. And I'm like, you need to get with the police, they need to do the wellness check. And because they weren't responding to her, she literally just battered and berated at me nonstop until I finally said, fine. And I drove over there. And the last thing I wanted to do was a wellness check. I am not mentally physical. I am not mentally capable of that kind of stuff. It turned out that I knew her next door neighbor and her next door neighbor met me as I'm walking. So, I mean, it turned out fine. But there is cases for spiraling and yeah.
No, I agree, those things are really hard.
I have to say though, I think though that you have done an excellent job, even though you say you're not qualified. Anybody who's a human being and is taking any initiative to answer those phone calls by simply just listening. That's the support that you're giving. That's what you're doing. So I'm sorry that it has been overwhelming for you. I wish we could take over the 211 phone more for you guys, so that way you guys would get a break. But definitely need to pull more. Joint capacity for.
Do we need to start talking about having maybe every other month or every month. A board member takes over for a week.
I think we need to do something.
So. That may be a conversation that we're having a little bit later on in this meeting.
Yeah.
It's definitely something that we should be doing. I think that the other thing, and I just wanna say it is, all of those calls need to be going to the FRC.
Too, but they are
But
coming
just
back, they're not,
Yeah, just still send them.
well, and they are, and you'll see it's CASA with these other ones, and then they're coming back and saying, CASA can't help me.
And that's when you call me. But I think, we also, phone number for the weekends.
Oh, see, I need that, I don't have that crisis number, I just got the main
I need to get.
intake number.
Yeah, I
I
know.
need to get that to you.
But 211 does have a training program.
Okay,
Yeah, because I see the other counties that go through it and their people are doing it. I was supposed to go to COGS and we were gonna go talk with their United Way, their 211, their health council, and get information out of Lee County. But because it was tied up with a city housing meeting, we had to postpone that one because we needed to be in the housing meeting. So we're gonna get that rescheduled out, so that way we can see it, but part of it is seeing what other people are doing. I mean, I'm here, I'm talking with the directors of the 211, and I'm in the meeting people's. But I'd like to know. Our area, you know, we're different,
Yeah,
so I feel like I can relate more to what Lee County is doing than I can to what Central New Mexico and Idaho is doing.
Yeah, definitely.
Because we don't have the same resources,
okay,
so.
All right,
okay. Sorry, I didn't mean to get
Yeah.
on track, but.
yeah, Con Alma
Well,
was next.
sorry, I lost my list. So Con Alma, they asked, I put in on the grant was 150,000 3 years. So that 150 would be divided out for the 3 years, I believe. And that was to fund a community health worker to actually go into the valley, into the community, actual trainings and more of those pieces to it. So you know how Con Alma works and know something in 5,000 years.
3 to 6 months.
Yeah. So, although this is to see if we're gonna get invited to actually do the proposal. So this was just a quick cheat sheet. And I don't know how long it takes on that one before I find out.
I don't remember what the date on that was.
Yeah.
I just saw it and I sent it to Carrie. I was like, this one.
Yeah, and when I did the community health worker one, I pulled information from everywhere. And it's a beautifully written grant, just like the 211 grant was beautifully written, if I don't toot my horn on it.
To your own.
You know what, grants are hard to do.
Yeah.
Until you get it down to a science, so.
And
grant.
yeah, and there's some things I'm wanting to write grants on, but I don't necessarily know enough information, and I have to have a program. I mean, it's been hard for me going to write grants, but I gotta figure out why I'm writing the grant, and who I'm gonna cover it for. And it's like, so it's like, as we get these subcommittees together, figure out what it is we wanna do. Once I know what it is we wanna do, we can work on budgets and stuff, and then I can go for grants to help cover that. But it's kind of hard for me, I'm working ass backwards on most of this,
Okay,
so.
all right. Overdose grants next.
Oh, that's not the grants, right? That's,
No, it says over
G.
grant. G.
G.
oh, okay, so that's our contracted,
Yeah.
grant, it's 10,000 for 3 years. I got my last billing on it will be 1,700, that'll be in June. We've got everything
Done for it.
done for it. I don't really know.
Are they ever gonna give y'all Narcan?
I got an email this week saying that we've got 36 packages of Narcan coming to us with a shipping link, so.
Okay,
Is this 10,000 per year?
this was just a one and done. Or is it gonna continue?
No, this is a 3-year grant.
Nice.
Yeah, so we'll have 10,000 over 3 years. Yeah,
July.
Emily was able to do one overdose training, so I hit the first quarter, are we in the second quarter? Just did one more.
This is the third quarter.
Yeah,
We're in the second. Oh, no, we're in the fourth.
We're in the third until. We are in the fourth.
Yeah.
We're in the fourth.
yeah, this one's weird because they couldn't
get their shit
They
together.
couldn't get the crap together and give me anything on a timely manner, so it was already way behind. So I mean, just getting the first billing done, I had to scramble and do 3 months worth of work in 2 weeks. But I think we're pretty good here on that one.
That's why people don't get their grant money.
Yep. And
Literally, but it's,
and this one is, Alianza has the other piece to this grant, because technically it's supposed to just be one grant. But Alianza did want to do this piece. And so they talked them into letting us do it, which is why we got it. And that might be why it's been so hard for us to get the Narcan, is because if it was pieced together, then maybe they would have had the Narcan, so Alianza could hand it out.
So we've got most of that money though, right?
Everything but 1,700, yep.
Yeah.
Nice. And then. Yeah. We're going on to the DOH funding.
Yep.
All right,
Sure.
so same thing there, our contract is 87.5, my balance to bill is 17. I am technically done, I'm just waiting for them to open up so that I can actually put it in. It's
All the
supposed,
deliverables are done.
all the deliverables are done. My last pieces was the chip and the root cause analysis. Well, Lori sent me an email and said that you have to have a chip meeting with the public and not in a health council. Well, guess what? Our Together with Veterans meeting where we had the biker group
That's what
was basically the chip meeting. It wasn't item by item on the chip, but it all discussed the chip. So I'm taking it and that's our chip meeting. So we've done chip meeting twice now.
Nice.
Our root cause analysis, because I've been attending these housing forums with the city. Dan and Geneva and HUD and Alianza, we've been working on root causes with HUD or with housing. And so I talked with Dan and he was gracious enough that he had already put together some policies that needed to be revised in the housing industry. And he emailed me that. And so that now we have our policies that need to be redone and that covers our root cause analysis. Boom, baby, we're done.
Nice.
Okay.
We love using
Well, why-
other things
why
to
do-
fulfill our stuff, yeah.
Well, that, yeah.
If somebody's already doing it, then
Yeah.
here we go.
So I have to say a huge thank you to Dan because I get a lot of my information from Dan.
Dan,
Hey,
so
you
that-
bet. No, you bet. That's the fun part.
So yeah, 17,000's left. The last billing cycle is 7/15. Next year funding is somewhere around 90,000. We just don't know anything else yet. All right.
Okay, so.
Are we gonna be able to count the expo this year?
Contractor updates, we'll start with Danny. Anything, should we have it written up in here in the packet?
I didn't print out yours because I didn't get to it.
There weren't really many updates other than we had the symposium in March. Really good turnout there. I sent all that out. The 72-hour reporting cards have been moving really good. I actually had another guy, the director of the ER. Of Loveless, came by and asked for more cards. So I'm gonna take more over there. So, and then gun locks are moving like freaking madhouse in the DVS office. So almost every day is, cause it overlaps so well. I'm pushing 988, gun locks, 211, together with veterans, all that stuff, and so it's. Else was driven. I don't really know much on the Facebook thing, because I'm not really going on, so.
So when they give me their reports, and because I have to track what is handed out, because that's part of our deliverables, right?
Yes.
So every time we have an event, if it's in their reports that they give it to me and break it down, then I can log it in here and then I know exactly how much information and what all has been passed out so that I can submit it out. And so here is our grand total where you can see how many we've done. If I don't get the reports, if I don't get the information, I can't add it into it. And so then I can only use whatever it is I'm doing. And it may or may not fit the bill, and nor is it enough to cover what all needs to be covered.
Oh, bus rides for March, Scott sent me an email and said they were actually 631. And they did correct that in our reporting too. Okay. So.
And I don't track that, but I think that's probably something, because it's not part of my deliverables, but I don't know if it's something at some point I may want to.
He has a really good login system, so he sends me the report.
Well, and it may become something that becomes with the behavioral health piece that's gonna be added to next year's. That could be added into that somehow, you know, I'll see what I can use on what we're already doing.
Well, like I said, I completed the OSA grant application for 1250. I don't think we've heard anything yet about from the TEP grant. You change people, right?
Yeah, so she's the chair, but I'm going, since Ari has started the process, so I'm gonna have. Helping her transition into it, so, setting up a meeting, I know they have to have a meeting. To speak with you, and they do that every year. But yeah,
Well, last year I was like, my kids were laughing.
yeah, thank you. Hey, you girl, oh my gosh, I'm sorry, it just.
Okay.
It's like, hi.
Okay, Carrie?
Alright, so you will see, sorry, I didn't get my event hours worked out on that one, but you'll see that I went through 29 different events and meetings. Kind of hit on some of the stuff. We've been doing a lot with housing needs because we have a severe, massive housing issue going on. So we're kind of going a lot into that. Dan has added my name. Thank you, Dan. To the NMS.
What is that?
It's the social determinants of health.
Yes, New Mexico Social Drivers of Health Collaborative.
And this steering meeting that I'm in is the closed loop network, which is 211.
Okay,
So we'll be working in that one, on that one.
I think your poor response to emails, especially for surveys, is a barrier. I think having your intern for this summer is going to help Luke, reduce that barrier, hopefully. In a way that may be meaningful to you to try to get some of this data you need.
Yeah, yeah, I agree on that one. Again, it goes through all the grants and where we're left on it. If you look at, the last page will give you our marketing efforts. And you'll see Health Council, we did 15 posts, which I'm down 13 from the month before, but the month before I had to do a huge push on something with the Department of Health. I can't remember what my program, I think it was the
Kindness one, or was it?
no, it was the branch, the overdose. I did a whole marketing campaign on overdose. And so that was that, but we're still gaining followers, we still got a pretty decent view and outreach on it, so that's not bad. Of course, Instagram is a different age group. And if we are ever gonna do something where we go to target kids, we'll have to add in another piece to this one because kids are not on it.
So there is the business suite for Meta
Yeah,
that you can download and it will post on okay, I was gonna say it'll post on.
oh yeah, no, I
same
don't,
time.
yeah, I don't, there's one place.
Well, and I think that the other thing is that if we want to try to encourage our younger generation to be philanthropic and really be a part of community, we've got to start targeting in those areas. I mean, that's kind of a bigger picture, but I think at the end of the day, we don't see people who are of the younger generation, donating, we're giving of their time and doing things for community. So we've got to start doing something.
TikTok.
I'm
Yeah.
serious. I mean, I don't know. I think that we need to start building the future younger generation to do the things that we do. We're gonna age out of this. We're only one person.
And I mean, ultimately, it really is true, and it's a crappy thing to have to truly think about in certain aspects, but really, truly, at the end of the day, the reality is they're the whole reason why we will continue to be successful 10, 15, 20 years down the line, because 10, 15, 20 years down the line, how many of us are still gonna be sitting around this table?
Right. So one of the things is going and doing the ZAG entrepreneurial fair. to that, we had our first meeting with the public, which was after the health council meeting. And it actually, it's partnering up with something that, the extension office and Wings for Life were mulling over. And then they went, oh crap, you could do your piece, we could do our piece, and this can be a great collaborative effort. But this would be a great introduction into TikTok, into that generation, and working into these new, because the stuff I post on Facebook, the kids on TikTok don't want to hear this. And it has to be done completely different. And so doing the ZAG piece to it, it was gonna work out, and that will go into that once we start there. And so, yeah. And you'll see Together with Veterans is kind of got a low performance. And again, it's because the target market for Facebook is middle-aged women. It just is. Together with Veterans is kind of geared towards men, and they're not the ones looking at it. Well, but we are at least getting their wives to an extent, or their
Or the
significant
female
others, or the female versions.
For the female veterans.
Yeah, and it's.
Well, yeah.
it's true, like, they're not being forgotten.
I know,
Anything.
I know.
There needs to be. This needs to be some sort of a serious conversation that we have in the very near future of how are we going to truly market ourselves? Because Facebook is not it.
Right.
It's only a small part of it. We need to be looking at all of these other ones and figuring out what we need to do. And it might be worth talking to the guy who does our video for the expo.
Right.
Talking to him and bringing him in, and is that a cost? Yeah, it is a cost, but are we going to?
Also, but he's also willing, because he wants to sit down with me and Carrie and have a conversation for next expo on doing other things. And slapping him up on sponsorships and things like that. So he's willing to talk like that about that kind of stuff, and he's in his 20s, so he is in that.
And Danny,
Right.
when I talk about Together with Veterans, I'm talking it from the health council stance, and for me, that's the chip.
Okay,
That's
can we
the-
bring up what the word CHIP stands for?
It's the
Okay.
Community Health Improvement Plan. And that is the gun locks and reducing gun violence for males in Chavez County and veterans. So you see, when I'm talking that direction. So I don't intentionally try to leave females out or however, it's just, I'm looking at the male side of it.
Yeah,
We're done for the day, so we'll make sure that the front door is locked and then
would you guys be able to go and gather the trash from that left from last night?
Yeah.
All the pizza stuff, or,
No, their building people will do it.
oh, good, hold on.
Oh, speaking,
Thank you so much.
Thank you.
sorry, I forgot about lunch. She said pizza.
When is it ready?
As we ready to do more. Don't work, they won't actually work out of this building either, so.
Well, if it's not possible, though, that's just so too what.
He was at a Las Cruces.
Yeah, I cleaned up the stand room.
Okay, anyways,
Um,
yeah, so because right now we're at a total of 4 suicides. There was one that was in Hobbs and in the American Legion parking lot. There was one that we had. There's 2 that were in March, one that was here in Roswell, one that was in Fort Stand, and then another one that was in Floats, so southeast. And that one was at the park, so. Oh, gee.
yeah, so we're gonna have to do something different with the outreach for the veteran piece to it.
I really like the idea that you had about putting the billboard with the gun, and then there was something, it was separate, it was at one of the meetings.
I know, I was looking for that, I couldn't find it, but I will
Yeah.
find it. I think I found my notebook everywhere.
Yeah, we had an idea.
Yeah,
Yeah, we were like, oh, that's good.
Yeah, I think if we were to even do
Sure.
that and then. Have it on because we can afford a billboard, can't we?
Yeah.
To other veterans, so I think that was something good.
Yeah, it was
And that
brought
would
up to do in the valley. That one will cost a little more, but we can do a digital one and one in the valley that says static.
4,000 for those.
But it might be worth our money because some of those don't have high turnover on those billboards, so it may stay up longer than a month.
Yeah, if we would pick that up, so.
Granted,
So, And then you'll see the traffic on the Health Council website right now is, a 211 is trending on the Health Council website. So we are getting into that traffic. And that's pretty much my report. If you guys have any questions, I can answer.
Just to ask you not to sign up for any more committees, because we can't slice you any more than what you already sliced, so please.
Did you hear that, Dan?
No is an answer, no is a response.
There's some of them, and I mean, there's a lot of meetings I go into, that's
That's a more than a piece of month in the day for the month.
but that's also part of my rules.
You do it.
And what, no,
There's
we
not,
get to the budget side,
okay,
I'm just letting you know I'm kicking her out and we need to sit down for a little bit.
yeah. Okay,
I can see it.
No, you're fine.
next on the agenda, together with the veterans.
We already went over one.
Okay.
Emily's contract or Emily's report is in here. She says her focus was revetting the resource guide, which is the 211. We did the food drive, which we did about 500 pounds of food from the food drive, just
Congratulations.
one day only. Because we didn't get food for the entire month from anywhere else. The food has been divided up. Alianza got a section of it. Food Not Bombs was supposed to come and pick up theirs. They still haven't done it. But in the meantime, yesterday I got a call from the methadone people, the methadone.
Renew?
Medmark,
No,
Would you say that?
Medmark,
Medmark.
no, different name.
Rehabilitation
But
Services of New
anyways,
Mexico.
Yeah, Recovery Services in New Mexico. They were trying to figure out how to do a food drive. And I'm like, well, you're gonna have a hard time, one, because they're not gonna wanna give it to you because of who you are. And which is why I said our food drive, not specific on who it was going to, it can benefited our community partners. I said, but I'm more than willing to share some of this food. So they came and they got a lot of food from us yesterday to take over to there because they have the same thing. They've got homeless people and different ones coming through that need access to food. So I figured it's all going out somewhere, doesn't really matter who it is, they're not necessarily a community partner with us, but it works.
Yeah, and especially since somebody was supposed to pick it up and they hadn't, so.
Yeah, and so I'll use it to whoever's gonna,
Yeah,
and
whoever,
I'll hit up Jocelyn again,
okay,
15 gun locks. And that's all Emily has on her report, the rest of it's empty.
back to, just really quick, the vetting of health, vetting for the resource guide, what is your deadline for that, for the resource guide for the health expo?
Early July, right?
I just wanted to have.
Yeah. I wanna say that that's what I have.
I think it's interesting.
It's in that one. You guys have bounced all over the place, honest, it's all over.
What? Why were things happening?
Well, there is so much on this
Keeps
list.
getting-
And it's literally, this is how some of these meetings.
So much of it ties in together, so.
Wellness guide to the printer needs to go by July 1st.
Did she vet that in a month?
No, by July 25th, sorry.
Whoa,
I need to be able to
She needs to be able to lay it out.
get it laid out.
Okay, what's your deadline for like just this vetting stuff?
I may have,
Your person's gonna be here June and July, but what's that deadline?
that is, I need all that vetting done by July 1st.
so they're gonna have a month
A
to
month
get that
for
back.
that?
back.
June, oh,
You said June 25th.
June and July, yeah, so.
No, she needs July
Yeah,
first, she
Which
needs
is
to have.
why
it
it was already supposed to.
So resource guide,
Hold on.
it's mostly making sure they're still in business, making sure we have the correct number. Because there's not much more information in the resource guide than that.
Right,
The other part for 211 is what's gonna take longer. So she's still gonna be able to go back to these resources and do that part. If she doesn't get to all of them,
No,
as long as
she
we
needs to
know.
do The health council the health expo resource.
Yeah, as long as she can get through and verify that they're still in business, they're still doing business and what their correct contact information
And
is
category.
and the category to make sure we know where they are, then that what needs to be done.
That is that I don't want her to mark harder I want her to work smarter, so part of that is, if some of that intel is for 2-in-1, there's no reason for us to have to go back in July.
Again.
Yes.
How many hours is she gonna be doing? Full or is she part?
20 hours a week, she's part.
It's gonna be a tough one.
Yeah, she can't, this is why it's all supposed to be done in the spreadsheet, because not one person can do that. Well, it can be, everybody can work on it, which is why the Survey Monkey, I mean, literally, you don't even have to be in the spreadsheet, it's the Survey Monkey. You can call them up and read them the questions off the Survey Monkey, or if they wanna do it themselves, okay, here's the link, go ahead and fill out your Survey Monkey. And then it's done.
Okay, so you said. Done, but she needs to be done by July 1st and then to the print by July 25th.
Yeah, because the expo is the 3rd, so that's 2 weeks with the printer. And that's assuming that we're still using newspaper.
Oh, okay, but no, I think we should not. That was a horrible print.
Well, and then that's may change some of that. So I'm working on some proposals. I was looking at this over. No,
Can I have it?
yeah, hasn't been opened. I'm looking at anybody else proposals for costing to find out.
I got tissue, it's in musty.
Dan did say that he was gonna go ahead and pick up the cost on the resource guide again.
We have research have sponsored.
So he will sponsor that. And if I'm talking out of turn, Dan, talk in.
Or if there's a budget for that.
Bill, yes,
Is anybody else? want it?
it's the same amount that we'll be providing from 100% Travis as we did last year, so that's $3,000.
So if it's above $3,000, we just need a budget for it, right?
Right.
Yeah, into the expo.
Okay.
So.
It'll
Carrie,
fall into
can I
the-
ask you a question too? If I'm not mistaken, last year we paid an outside contractor to do this, and so you're taking this one over this year?
Well, I was gonna take it over if we were funding it because it made no sense to pay an outside contractor.
Yep.
Because ultimately he laid it out and then I
Yes,
turn around
so
and.
that's what I wanted to make sure of. You've got all of the digital assets, correct?
Yes,
Okay, that's perfect. That's what I was hoping for. So that was also another thing I wanted to bring up. So last year, I believe that the $3,000 that we used for the sponsorship of it, 1,500 went to contractor, 15 went to printing, approximately. I mean, that's, fast, loose math. But in this case, y'all would be able to take the 3,000 and put it towards everything. So that I think might help also defray a printing cost if you need to change.
But you know,
Because we had talked about having it printed differently
100%.
because the
Please no.
newspaper was
Please
not
no.
good. Can we take what we print to the newspaper and have them put in the newspaper like we
Yes.
did?
You can pay a fee to the newspaper after you pay for printing outside
We know
resources to do a
Yes.
tip in, so they can tip that into the paper.
100%,
think
yes.
that's-
but when they do the tip in, it needs to be a print like. On their newspaper print, is that correct or no?
No, I don't think so. If you look at a lot of them, there's different types of things. You
Insert
see
the
there's
different-
slicks, there's different things that they can tip into it, I believe. They may have specific requirements. I can't speak to those specifics, but
We need to.
I don't think it needs to be specifically newsprint to be tipped in.
Okay,
But I agree, it was shit last year.
yeah, it's hard to
That
read.
print was.
It was disappointing. It was disappointing, but at least we did it. So, but we did
And-
better.
And then the other thing is, we gotta jump the number up, it's gotta go up to 10,000, we did 6, I was out before Christmas.
No, it just shows the need.
And
Definitely shows the need.
the jail asks me every time they see me, do you have more? I don't, so they have the digital version so that they can do it, but every time they release prisoners, they give them the resource guide.
Nice.
That's good.
So,
That's interesting.
That's something to kind of think about in the write-ups and asking people to do write-ups, where the biggest handout is going. So it's just something to think of. Okay, let's keep going. Okay, anything on this? I love it. Okay, Home Expo. Anything else for the Home Expo, guys?
Now we're plugging along, we need sponsors and booth vendors.
yeah, right now, I wanna say I am sitting at. I hate this stupid bar, by the way. Have I told you how much,
Push it down. Hold it, right.
how much I really hate Zoom? So I have to have that in every meeting, so you know,
Our sponsors
We're at 11.
for 11,000.
as sure to last year, or we were last year.
I wanna say our sponsorships was, well, we hit like 20,000 last year, right, between sponsors and dues.
20 here.
Where we at this year?
This year, right now, our total revenue is 3937 that we received, but I still got. 3,000 out from the hospital, Loveless has got 1,500 out. And then a couple little small ones. 5,000 from the hospital. Delta Dental has paid, yeah,
I'm showing, Loveless has not paid and Eastern has not paid, so if Delta's paid, then,
yeah,
but.
so that's, gives us, we got 11 sponsors right now.
And booth vendors?
And booths, we are at 30. 30. And I may have,
Well, that's 30.
And the number of-
It's the individual organization.
right,
As compared to,
it was it was like 109 booths
That's
last year, and it was 50 individual organizations. So we're
almost
getting-
there.
we're getting,
Well,
Yeah.
that's quite a bit.
And that's part of the reason why we dropped the price too, was because of.
And has the deadline passed for those or not?
no,
No, it's,
So just together, do we need to do anything to have a table or?
No.
We're just like, right?
yeah, I don't know how we're gonna work out yet, but, I'll work on us, because of the mall being different, but I'm also reaching out, like I'm trying to with Bobby, since Bobby wants to do haircuts and lice checks. I'm having a hell of a time, but I need the college at the mall to open up and let them use their facilities and make that, but they're not open on Saturdays. So Emily went out there and she's the one who had the contact with them, and said, whoever she talked to said, no. I'm gonna go back out and reach out and say, yes, you guys are gonna have to do this. Because if Bobby can get his people together and get the other beauticians, people, hair cutters across Rodwell to organize. Then we can
Right, it would really be good promotion for them.
Yeah.
It really would.
So.
yeah, and Tara's not there anymore, so we don't have that in.
Right, but Tara did give me who I need to go talk to and said, hey, tell them I sent you. So I'm gonna use my connections as much. But the guy that normally owned it died and now it's the son, and everybody that was there has left. So it's kind of a thing.
Kind of a thing, yeah.
Yeah,
Okay. Okay, anything else on the school? Anything that we're can do support?
I'm just
yeah, right now it's,
Yeah.
yeah,
No, I think it's.
coming up with new ideas.
Best pivot you possibly can do.
We're gonna have fun with it.
Hey, I'm just.
We are gonna
get
have-
to do the reps here and do the health expo itself because.
Right there. No, down one. Right there.
We are gonna have some crafting times.
Oh, fun.
Because we're gonna make decorations and stuff for our booth, because we're gonna do Pac-Man theme. Ours and have the ghosts at the. So you know how we do the scavenger hunt, the ghosts are gonna be at the booths where they have to go, so like they have to.
So much fun.
I've got parts of it, it's not really done yet.
That's fun. Cause we're gonna do the same thing for the women and stuff too. We're just gonna have them run around 4 times this year.
Oh, it sounds awful, it's like, no, live long.
But, there's also been a lot going on right now, well, and they're gonna put a lot of focus into that, so I just have 75. Okay, we'll have them dress up and
Let's
do
do,
the fun thing and, yeah.
let's do it. Okay. The Hammer Health and Wellness.
So the only thing I went ahead and I did a invite to the meeting, which is next week, I believe. I don't have agendas or anything, so.
Are doing it on Zoom, right?
Yeah, it will be at 8 o'clock at CASA so that we can do Zoom. And then, we'll need to, once hopefully. A bigger group shows up, and then we decide if it needs to stay at 8 o'clock or if it needs to go to a more. Normal hour for everybody else, yes.
What day was that again?
Next Wednesday at 8 AM, 21st.
Yeah.
The only thing that I would ask is either you or can somebody type up minutes for meetings so we can blast those out with the invites?
Okay, so. Yeah.
That is fine, obviously, but next time.
Well. And this is supposed to be the one facilitating this, so that's supposed to be on her plate to organize this subcommittee. Okay.
Okay, do we wanna go ahead and do executive session and then do budget?
I'm gonna propose yes, because there's a piece that I wanna bring up, but. I don't want some people around.
Okay. So let's move into executive session and you can start recording.
Just hit pause on the recording. Cause we want,
Just
yeah,
hit the bar.
It's right there, it's right there on the right hand side.
No, just-
Oh, here we go. Yeah, no.
you can stop share for a minute. Red. And budget.
Let's go back into the board meeting. We're back in session. It is now 12:24. I'd like to just briefly go over the executive meeting before we go into budget, because I think it impacts the budget. So Carrie, what we have decided and voted on is that we, in the new fiscal year, we would like to raise your salary, to 55,000 a year. We also have decided that we are going to terminate the contract for the community health worker. And that will be done within the next few days. That person gets 15 days, to respond to the letter, but it will be effective 15 days as the writing of that letter. So we envision that to be mid-June. That'll be Emily's contract. We are going to, look into the Goodwill programs, work initiative to have somebody work, and they pay for their salary or they pay for their hourly rate to be
Yeah,
working
CSEP.
that. So for the 2-on-1 person, but that's gonna take time. So from now until we can get something solidified, what we are going to ask you to do is to submit to us an extra invoice for the extra work you're doing for 2-on-1, so we can compensate you accordingly. We also have decided that we're gonna advertise for, if the Goodwill thing doesn't happen soon enough, we're gonna advertise to hire a part-time 2-on-1 person. It's not gonna be a trainer, it's not gonna be a community health worker, just 2-on-1 specialty person. That will be part-time with the incentive that once things pick up, that it would go into full-time and we would pay that person $17.10 an hour. Also that the board members want to help with 2-on-1, so we need to come up with a schedule to help you in the interim. So in the new fiscal year, board members are gonna sign up to do a week or something. Yeah, so with all of that, I think that was all the.
Anything. We're moving to a salaried exempt employee.
For next fiscal.
For next fiscal.
Any questions or comments or concerns?
No, I honestly, I think that's wise with that director position, because there is the extra events and activities. That's kind of hard to do that and cut down the day-to-day work. So
Not to mention, it's gonna put you in a position where you don't have to submit a tax sheet. Okay, any other comments, questions, or concerns?
on the 2-on-1 supplemental invoicing, do you have what I'm submitting?
Just,
What are you doing?
if you're vetting,
If you're vetting, if you're taking, how many phone calls you're taking, all those, you know, the basics of 2-on-1. When the type that you,
Yeah, but if I'm already working in the one position.
If you are sacrificing your directorship position to do 2-on-1, that needs to be honest.
Okay. So if I look at April, it was about 4 hours worth of talk time on
Yes,
the phone.
we need to
Invoice for.
invoice report, yes, yes.
Which I can track that.
Do it, please, okay? We really want you to know that we see you. And we recognize that you have brought that council to a whole new level. But it's not fair to you to carry such a burden. And we're sorry we haven't recognized it sooner, but we do know that you have done us a world of good, and we want you to know that we want to compensate you for that. But we also want you to know in the new fiscal year, we're gonna compensate you for that. So thank you for all that you do, Carrie. Okay, let's go on to budget. Fun part.
Hey, I do
Yeah.
have just a question. Hey, Carrie, did you
ma'am.
ever get response back from Emily from your email?
The response I got was she sent me an email. Hang on, I'll pull it up. Okay. Bar. Okay, do you want me to forward you the emails? They send after the meetings. Um. The two negative K are written notes, but I. So this is what she sent me. This is what she was gonna submit. I was like, and I went back and I told her, I said, that's fine as that, but I need to know. At this sprint meeting, you know, who is it with? What community partners are there? I need your summaries of the meeting minutes, and then that's where I showed her what mine were. That there's the list of the meetings that I attended in April. And then I sent her the link to show her what one of my meeting notes were, because this is why I have AI on all my meetings. And so it can go ahead and pull it for me. And then if I'm in a meeting where it's an organization that actually does minutes and all that stuff, I have to submit agendas and minutes when I do DOH billing. And I'm like, and this is what I have to have, because you're supposed to be doing the 988 and these pieces, and this is what we're billing on. And I can only do it based off what I've done, so I make sure that I cover those meetings to be able to do those pieces. So that was my response, Sonia. Did that answer your question?
Yes, thank you.
Sonia.
Let's talk budget, Carrie.
All right, so budget. What I did is I put together fiscal year 26 using it the same way that we currently do all of our tracking on invoicing and everything. So you'll see the budget exactly the same. No, sorry, I'm just lying. I am lying. Thank you. Does that work? That's much better. Okay. So right now, what we do know is that we'll get 4,000 out of it together with veterans grant. We know DOH is gonna sit around 9,000, and we know the overdose is 10,000.
Oh, Nick, can I ask you the overdose? Is that a repeating grant? Is that what I heard?
It's a 3-year repeating grant.
And then the 90,000, is that the 10K for CHW work?
Yeah.
And the deliverables would be something that, do we need to hire somebody using that 10K? Okay. I just want us to be aware that there's some additional stipulations with the additional money.
I have a feeling the answer is that we may need to. But I'm not 100% sure, because they
Okay.
haven't done their scope of work yet.
Okay,
They haven't done squat. Including tell us exactly what the amount is.
it's gonna be last minute.
Is that overdose, does it have to be a CHW?
No, technically, the overdose, I am qualified to do.
Okay.
Because I did the first one so that we could do all the billing.
Okay.
So it's doing the overdose training, that Narcan training. And that's what Emily just did her first one on this week.
I do need.
Well, and I'll tell you now, it's a stupid training, by the way. But.
Stupid trainings can be dynamic, just so
Yeah.
you know.
Yes, spreadsheet.
Trust me, I'm not. Literally in my head, I'm going. How many times have I said that's a really stupid training, and there's something that comes out of it that's actually not good enough for someone?
The trainer has to make it be something worth your time.
Right, and I'm gonna have to spend more time into this pieces. I have just barely taken the training program piece to it. And then did a training right after that, because I had 2 weeks to get a billing done. And nothing had been moved, and so I was rushing it through, which is why I did it with people I knew. So that way, if I fumbled through it, it wasn't gonna be horrible. And and I knew I was gonna fumble.
That's a good way to do it.
Yeah, and the feedback I got was, it was for,
Was horrible.
that's all that I got. No elaboration, just, it was for,
The training we gave,
Emily gave.
Yeah, the spread, the slideshow that is on it is a horrible slideshow, and I'm gonna have to talk to Sarah, we're gonna have to fix it.
Well, and that's what we do with our QPR. The QPR, the basic slides are not good. They're not good. They're very basic. They don't have any good things and we add to it. We can't take out any of their slides, but we can add our own in there and that's what we do.
Well, and
if
apparently,
you've done a QPR training with anybody other than. Then you know the difference between the two.
and I haven't, I don't. think-
DOH does them and they're an hour.
Well, and if anything, this is a DOH presentation, so that tells you what the quality of the slide is.
I mean, I'm happy to add to your slides to make it a better presentation.
Well, they have, everybody's using the same slide sets, that's
But ask if we can add to it.
yeah, well, and I'll have a conversation with Sarah. Okay. There was some mistakes in it and they were supposed to fix some of the mistakes on it that they caught when I did the presentation. And I wasn't, well, I might have been the first one, who knows? But anyways, yeah, so that's what I know right now is where we're sitting at with our budget, roughly about 104,000. Expo, I just put 13 in. We know that Together with Veterans, and as you see, I wrote 211 out. So that way we can see if we get that 40,000, what that's gonna look like, caring for seniors. I'm gonna have to come up maybe with a different abbreviation for the school health. I still don't know.
Shit, that's what I was wondering what shit was.
Well, it's too long with everything that they have on it. I need a shortened version of it.
SHU, school health update.
Okay, I can just shoot, because yes, I'm putting it in there and I'm like, shit, and I'm like, it's wrong, but
Talking about the school health team, did we sign up?
not yet. They're having some technical difficulties on their,
Okay, it's not us,
Their money.
yeah, so.
it's not us, no,
Yeah. And then we have the behavioral health and wellness, and I don't know, Judge Hudson said they have like about $1,000, but whenever that money comes, then we'll just add it and we'll, we'll keep everything separate. If we get any other programs, this is how it'll be, I will break it apart. And then this way, every program has their own operating budget. We need to see what they're. Even in the case of, let's say that 211 does not get the 40,000 and the general account is offsetting the 211 cost. We need to actually show it that that amount of money is coming out of general funds to cover 211. So we're just transferring money from the general account to the 211 line. And then this way we can always keep it separate. And this way, if I have to write a grant, I can say, look, this is what we have to subsidize on this. And it's taken away from this program. Any question on revenue?
And just for the Together with Veterans, is this our last year?
End of
Yes.
26.
FY 26 or
No.
calendar 26?
May of next year is when our funding's done. April of next year should be our last check.
Now,
Started May 2 years ago.
one thing I'm gonna put out there. Is I really strongly feel like. We can't do much this year, but we can keep very, very close track of everything that we do. I really think that we need to be going to. The city. We need to go to the county. We need to go to Hagerman. We need to go to Dexter. I don't care if it's $1,000. We need to be asking them for money to help support. This organization, and I think what you're setting up right now. Is going to help us out because then you can officially show. This is everything that we've done. And we can show that fiscal responsibility. Which is going to allow us to. To handle this stuff a little bit differently.
Yeah.
Yeah.
Well,
We've
and-
wanted to do that for a long time. All get those line items. Things from city counties, all that kind of stuff.
And with that, on that piece to it is, that's also where we need to set up a yearly. Agenda of what it is that we're gonna do, so we need to plan, like if we have community health workers actually going out into the community and providing trainings. We need to schedule it all out, this is what we're gonna do, and this is what we're gonna do in these communities. We may have to modify some dates and stuff, but We need to say, look, these are the programs that we're offering you. This is why you need to give us money. This is what we're doing for you. And I don't want that to be done, you know, the week before we decide to do it. I need schedules, because that's also back to, I can do grants around that kind of stuff, especially if we have things planned out. All right. So, and that puts about 196. There's a magic number on, finance accounting, isn't there, Dan, on, well, you have to submit your 990s or something, there's a, like 200,000, 250,000.
Yeah, there's different thresholds, of course. I think it's the 50K before you have to move over into the 990 easy, and then once you hit, I want to say you're right, when you hit the like the 200,000 mark or so, they kind of change those rules every so often, but then you move over from the easy to the full-blown form. Health Council moved from the easy to the full-blown form the second year that we did. So we're on the full-blown form now. That number that you're showing there, I think, is the easy threshold. So it would go back down, you know, to the lower type form.
And honestly, I expect it to be higher than that, but
United Way,
that's the 40,000 from United Way.
phenomenal.
Conalmo, because we haven't received any money, but if I get the Conalmo grants, we'll see that pushes that up. There may be something within the constellation, because there's some stuff that they're talking about, nothing big.
We've never really gotten a full amount for United Way. Is it safe to say 40?
No, but that's what I gave them on my budget. When I gave them my budget, and again, this is just budgeting pieces, and so when it comes, it'll get updated and reflect exactly what we're looking at.
And part of the thing that's not reflected on here anyways is carryover.
Right.
So that's another piece as well. So when we get down past this and we really see that bottom number, that's only a reflection of fiscal year 26. That doesn't reflect anything that has been moved over for fiscal year 25.
Okay. I left the expo money in there, one, because we're gonna be active inside the expo right now. So that's not really carryover money, it's kind of like established money for it. And then I left it together with veterans up here, just because these were the existing numbers. But again, those will change as we move into the next fiscal year. So then if we go down to the expense report, or the expenses, this reflects everything that we have paid year to date, plus the contractors' salaries to the end of the fiscal year, the rent to the end of the fiscal year, the cell phone usage to the end of the fiscal years, those numbers that I know that happen every single month of their exact same amounts. I moved them over and added them into it. So those are there.
And we haven't had any notifications of anything going up at all.
I have not seen anything.
Okay, I figured I would ask.
Yeah, so, and then I do have. And if you wanna see, here's, you know, if you wanna see what we're doing under advertising, let's go to accounting legal. So here's together with veterans, it was $176, it was the event insurance. This is, I just rounded out, again, this is an estimate, so 180 for the expo insurance. This was our payment to. Yeah, then people. You think I can read, but whatever.
I'm telling you, you need to get glasses. Join the crew. We're not that
I
bad.
could see it, I just, my brain wasn't really hearing it. But here is the breakdown where I can show you exactly where things have been paid out into it, and so that you can see the softwares and the various things that we've gone through. If you want to see the detailed part of it. But coming back over here, and again, I broke it out so that way, because we know we have expenses automatically under the general, the expo, and the together with veterans. These ones are already divided out based off of what we already paid into those areas. What I did with 211, again, because I had to submit that to United Way, I moved over the labor, which was Emily, since she's the 211. I moved her salary over there. The telephone bill here, this is the Cricket bill only. And this 485 is the 3CX, what dancing does for that phone. So this is definitely our phone. and I moved all the cricket over to them.
Okay.
And the rent, I divided it half and half. Perfect. Just because I needed more. I have to justify why I wanted everything.
On some of these things that we probably need to just have in the back of our heads, even if we don't add it strictly to the numbers at this moment. Some of these things like advertising, some of these things like sponsorship, some of these things that involve us purchasing things. We probably need to add a 10% onto it for inflation, just to cover that. Because we don't wanna go into it thinking, oh, well, we've got we spent 5,000 this last year, that's what it's gonna be this next year. I would bet it's gonna go up.
Agreed.
My
So-
gosh, our inflation rate going up that bad?
It's always worth covering about 10% in those areas, and then if you don't spend the money, then you get to fluff it into another account.
It's better for us to overestimate.
Overestimate.
Estimate.
Yeah, and again, it's budget, it doesn't mean anything, it's just a planning tool. Oh, I can't, I go there. So here, like, if I wanted to change this, what did you guys say?
55.
Nope, that's wrong. That one. Okay, so then that'll change. That budget there, so that now reflects the new, so,
Can you go back to that and can you change the Emily's now 211 expense?
yes, but no, cause it's tied to the 211. I wanna leave it there. Because I wanna say, look, this is what we need for the 211,
Tell me what you have for her.
39,
39,520.
and that's more than if it was full-time, because it was like 35.5 and something. For the hourly that we had changed to.
So at this moment in time, can you scroll down? With the way that those numbers are, and if we include approximately the 75 to 80,000 or so that we're gonna pull over from this fiscal year into next fiscal year for the general account, we're pretty close to breaking even.
Well, actually, no, we're above breaking even, so if, even if, well. So right now, we don't have, we'll pretend there's no 211, so okay, this isn't gonna exist, so we won't even look at that, the column doesn't. So this is without Emily's salary in it anyways. This right here. Will you circle it with yeah, right there, so that is just my salary. So it doesn't include the 2-1, so if we ignore the 211 line, we're showing that our revenue is gonna be about 104,000. And our expenses are gonna be around 77,000, that's gonna give us a profit margin of 26.
Can you tell me again that 104,000, what grants are connected to that again? Just so I understand correctly.
That's 4,000 we pull for usage of. Together with veterans, okay, 90,000 from Department of Health, 10,000 from,
Voters grant.
yeah, the overdose.
And we know those, we're absolutely gonna have those.
Okay, and then can you scroll down that again? And does that include, any overage like that we're gonna, like you said, for like, insurance if that increases, so we're.
No, this right now is set numbers, so from there, I can.
But you have 26,000 a plate.
And that doesn't include
What's
what's
Any.
going on.
Okay, okay, so,
So if you don't have Emily's salary, is that gonna increase it?
No, because Emily's salary is over here in the.
budget line item.
Yeah, it's out of 211,
Oh,
not out of general.
okay.
And so if we use that, when we use that, then the money that we've allocated for that, we've got to look at that to make sure that that's in play. But right now, it's not in play, if we look at the budget right now.
Right,
Yes.
so let's say United Way goes ahead and does give us that 40,000, then we will need to hire a contractor, somebody to utilize the 211 line. And we will show that it's gonna compensate for that. If they give us 20,000, okay, well, we hire a part-time person who can cover the 211 line, that'll cover that.
And
If they
the
give us
time-
5,000, we say, screw you, and we don't hire.
Exactly is what we're gonna say, but if we can take advantage of that goodwill person, maybe we can start from that perspective. can you tell us just really quickly, what are the expenses that we are seeing for FY 26? And if you'll just go down the line and just verbally say them out.
All right, and so. Advertising. Because the health council doesn't do a whole lot, so we're looking at, under 700 for us. The expo does quite a bit. This number.
Let's just do the
General
council, yeah, just the
Okay. All right, so yeah, advertising for the health expo or for the health council is minimal, but we do need to increase this because we do need to get. We're talking about like paying for swag, marketing, advertising.
Okay.
So is this 655? Is this what we spent this last year?
Yeah, this includes those beautiful cups.
They are nice.
I seen them yet?
No, I was not privy enough for,
I think I
wanna
want to
get-
get part here.
You wanna get
Let me last month.
well, then, okay, I'll give you that. So
Place at the right time.
we probably need to bump up advertising.
yeah,
I would say that 1,500. That covers a little bit of inflation. But that also gives us some wiggle room too.
Okay.
here,
She gave it to me for some reason. I have no clue why, but
For you to do all of this?
I don't work, I don't handle her spreadsheets.
That's a complicated spreadsheet, by the way.
It's the same spreadsheet we use right now for the accounting.
Guess what? It's complicated.
So how much do we wanna put in here? 15? 15?
So right now it's at 655. Do we want to put in an extra 15 or do we want to go up to 15?
Up to 13, I think.
Okay, so what was it at before?
650.
655 was.
I think it's okay.
That's for me.
Okay, so I'm just gonna go 6.
41.40.
Okay. Cups.
Thank you.
Thank you.
844.60, please. Oh, those are awesome.
Aren't they?
Now,
Dirt
what price? How much do you think you paid for them? Very, very big for them.
Well, she just said dirt cheap, so I'm gonna go $5 a piece.
Nope.
$1.
Cheaper than that.
Really?
$1.
What was it?
So the cost by themselves was 44 cents.
Oh, I was getting close.
By the time I added in the shipping and the plate charge, they were 55 cents
Where'd
each.
you get these at?
The clearance section of Fork Imprint, I'll have to send you the link because.
Yes, because I'm gonna be buying some for the.
So, yeah, she got some for us.
If they're
because
still
veterans.
there.
Yeah, and she got them.
Well, that's why she sent them to me.
That's so cool, right?
Yeah, we got.
Awesome.
We got green
Army
ones.
green one, yeah.
Yeah, Army Green, put
Okay.
together with veterans.
So advertising now is at 15.
Dues and subscriptions are 2402.
And that is.
I stay the same.
Insurance, right, or board insurance.
No, the insurance is not on that one. There are a few changes I'm gonna have to make in here because I found that insurance, I didn't get all my changes made yesterday. But the board insurance is not part of that one. That was, well,
That's on legal, right?
what was it I was talking about?
Dues and subscriptions.
Thank you. Y'all have to, put my brain back into place.
It's in alphabetical order, right?
Yeah,
You're on the ease.
hang on.
There you go.
I can do it with the mouse, not my hand.
Okay, so Sam's, that's under Expo though.
Microsoft got billed to us, even though we have a free subscription of Microsoft, but I don't know which versions we are using in which areas. It was a carryover.
We need to set up an account with TechSoup. And we need to start using TechSoup, but you also need to go into Microsoft. And you need to set us up as a nonprofit and you will get,
Which we have and we're already done. This was something that was already set up and filled out before I knew that we had this piece to it.
So
Because
the
it's
next
on
year it
automatic.
should come through.
No, because your credit card's about to expire. Fine. So everything will have to be redone and reset. What I don't know is the cloud pieces. If all of that was covered under the free cost, or if we're having to pay a cost.
It's the pre-cost that
Pre-cost.
Dan set us up, so.
Okay. Yeah,
That should go.
so that'll go away, the New Mexico Health Alliance is there.
Okay.
I don't know if we wanna keep it at that, I have my own opinions.
What is your opinion?
My opinion is
State
they
it.
were should,
Who?
The New Mexico Alliance of Health Councils, they really have gone to shit since Sharon left.
What are we getting out of that?
it is,
Costing more money. They do the lobbying,
They are
so we
packed.
gotta remember, we get them, we have gotten.
So it might be
those
worth
money because they have been
$1,000.
lobbying with the legislature for more money to health councils. Remember, before we used to get, our budget was 3,000 to, and it's went up to 10,000. 10,000 was the most we ever got. So the last 2 years has been the most we've ever received, and it's because they lobby,
So I say let's stick with the $1,000, and this is my opinion, but I say let's stick with the $1,000. And everything so that we have it there, and then if they can start bringing us more money, then we can start talking about something
Yeah,
different.
I think 1,000 is fair, only because it has increased exponentially. We
Right.
were living in the days of pennies, so
the 7,500 that they asked for originally,
no,
the-
absolutely not, no.
And I understand about needing to pay for lobbyists, and now that I've got a year under my belt, and then I'll go back to DOH saying you guys are stupid, you guys are gonna have to do some more. It's stupid, it's gonna be my word today. Y'all are gonna have to do some more training, so, and you know, part of it is when they went to Santa Fe to lobby for, when they were asking for 43 million. They could not answer the legislation when they asked them what they will get for 43 million. What is it the councils are gonna do? They couldn't give them a definitive answer. And it's like, and yes, every county is different. But we all have the same mission, we just have different pieces that we use out of it, because ours might be, we need to focus more on suicide. Whereas Lee County may need to focus on drug abuse more, STDs. Right, but is their STD program gonna be different than say Valencia County, who has an STD program? No, it's gonna be kind of the same thing. Because it's an STD program. It's just every county picks and chooses which pieces to it, and the fact that the alliance could not answer this. It
Alliance or DOH?
it was the alliance couldn't answer it. Cause DOH can't lobby for the funding.
No, that's right, I mean, they can't be there.
Right, so this is all coming out of that, and the only reason we got funding is because somebody in the finance committee used to sit on the health council board in their county. And they pushed it through. Otherwise, I don't think they would have gotten this money on it, to be honest with you, because they should have been. So that's my opinion on it.
And that is 100% because Sharon left. Sharon was fantastic in that position, and she advocated so much.
She helped us grow. And I leaned in on her when we were first. Starting those, okay.
So Survey Monkey, Zoom, those you say, Wix has already paid, this is a 2-year, because I had to pay it whenever to transfer.
We need to budget it though.
But we do need to budget it, but we don't necessarily need to budget it for this year. But I'm gonna leave it here because
Yes.
we may need to add some other piece to
Can you
it.
put a note to it? Just put Wix website, next to Wix website, just kind of put a note over there that it's generally charged every 2 years. And the only reason I'm saying that is because we wanna just make sure that we don't forget these little
Little
details.
details, okay.
Okay.
Alright,
Also, I'm gonna put out there too, and I know where you guys use your email and stuff. But I don't think it's too much more of a charge ultimately with Wix, and you will have Google. And the thing with Google is you could potentially cut out Zoom, and go with whatever their one is. So there are other options that can be worked through that.
Workspace or something like that?
No, there's I can't remember the name now. It's like Zoom, but it's through Google ultimately. But it just
Kind of like Microsoft 365 and Teams.
kind of, yeah. So, but it might be something to research.
Yeah, we had talked about going with Teams since we already have the free version, but Teams is.
I've been in enough Teams meetings that even though I sit here and I hate Zoom, I hate Teams more.
Yeah, Teams is usually but it might be something at least to look into and see if the charge difference might save us money by cutting out Zoom. So, cause most people run under Google in some way, shape or form.
Sure, man, or I.
You can still do it.
All right, so that's your dues and subscriptions. Contractor labor, we've already gone through donations and contributions. This is one, it has nothing in here, but this is where we were talking about that this probably should be the, and I'll use the expo. Because, we pay for mammograms, we pay for vaccines, we paid for something else. That's a donation back into the community, and if we keep it into the donations and contributions, we could say, look, this is what we gave back at these pieces.
Well, then $5,000 should be there, right, that we. But
Yes, it should be.
Yes.
Now,
Because this is a line item that we don't use.
so
So
you need to talk
it's
to,
over here under sponsorship.
you need to talk to Betty,
Two of it.
and we need to move it. Cause like we talked about yesterday, Betty is gonna plug in what you tell her to plug in, and if you tell her, this is where I want this at, this is where it's gonna go.
Right, and I'm gonna come in here and I'm gonna clean up some of this, because one thing I wanna get rid of is a generic together with veterans expense. No, I wanna know, what are your expenses, break it down to me and see, because if the grant goes away and if we carry on the Together with Veterans program, we need to know what we're spending and where it's going. And the expo is the same thing, so there's not gonna be any general dumping of funds.
So you said you have that 5,000 under sponsorship right now. What's the other $2,535.94?
We've got.
Oh.
Hagerman Forward, Flood Visa card.
Oh, yeah, so see, this is something that's not gonna carry, again, like I told you, I just pulled it over from what we spent. This was money in, money out, this was the flood money. And so we've only done,
Yeah, that's all we've done this fiscal year is Choice for Tots and the FFA. What's Walmart? That was,
employee bonus,
Yes, so that was,
that doesn't go under sponsorship, that needs to
No.
go under.
that needs to ultimately go under contractor. Which is gonna be employee. Anything that's bonuses and stuff like that, it needs to go under the employee aspect. Even, we need to recognize that as employee.
I think that the reason we did it that way is we just didn't want it taxed.
Correct. And that's true and stuff, but that still doesn't take away from
Where it should have been.
where it should be categorized.
These other two here are under prizes and gifts.
That's my opinion.
Yeah, that goes under the, cause that was just bonus for Christmas.
I think we could also move it to, as long as we know what we're budgeting for, but is there? Another, could you go back to the budget line item and just look at the list?
And again, we can change these things and we can add if we want to have something done differently. We just get with Betty and get it set up.
Well, and I think we should,
Employee appreciation line item or something like that, since we're going into a new fiscal year.
I mean, we ultimately, we could do something like that, but that still comes out as a subcategory of employees.
Employees, that's what I mean, though, I think we should do it that way.
So is it employee contract, or I understand the contract?
Yeah, you will, and it still applies to you, but yes.
Yeah.
Okay, I'm just, my friend.
Yeah, so contractor labor, see, this will just be Danny and then like, cause.
And
we
then
don't
there
have
should-
Line item for mine.
Yes,
Where's the, I'm sorry, but it's together with veteran one, where's the line item for the 4,000 that we pay y'all for being our physical agent?
So it's up top, you scroll up.
No, we.
No,
Okay,
it comes out from here.
It's not there.
Oh, see what you're saying. I think it's up to date, so it's not the whole amount, so it's one of those 3,000.
So we,
For next fiscal
what I think we need to do add on here is add a line. For fiscal agent fee,
We did a one-time,
Agreed.
and we still need to, don't we still need to pay on that?
we'll need to pay for this next year.
Yeah, it's
No, we
4,000
need to
a
pay
year,
for,
right?
no, but we didn't pay 4,000. We only
It was
paid,
a big expense to catch us up.
yes, but we still have to pay for like half a year or something like that.
Yeah, if it's not in here,
Well, is that what that 3,300 is then? Cause you do have a 3,300 line item, and then there's an advertising one.
Well, that's what I'm,
But I know the advertising stuff was for the,
so.
was that a percentage stuff or the, what, that's the board.
Okay.
Yeah,
If it's not in here, that just means that we haven't reflected it in, the FY 25 account.
we have though, cause we,
No, we did it. When did we do that?
It was like not that long ago.
it was it was in the fall. Cause we did a huge chunk to cover into
When it first started.
fiscal year 23 or something like that, 20, yeah, so we went back quite a bit, but we still owe for
Or
some of this year.
Yeah, but what I'm saying is it hadn't been recorded in the monthly. Whatever month that we did it in, we didn't show it as coming out of Together with Veterans and then coming back in.
Didn't we have to write a check?
Yeah, but if it's not in here, it's because this is a copy and paste from FY 25.
So we need to,
Get off.
where did I send a text message? Or an email?
Are you in FY 25?
I can be them.
You in FY 25?
Pasting.
I wasn't trying to cause a big old issue. I was trying to make sure that's.
Why budget meetings take time, it's because there's gonna be somebody who's gonna go, what about this? Yeah,
Get to get honest with it.
Events. Events, one child a week. Yeah, I'm not seeing it.
And I didn't see the grant. I don't know if that counts in there or not. For the TDP grant.
So that's a credit. So
I
I
was in the top.
but I wasn't anticipating.
Oh, okay.
yeah, we're not anticipating it for fiscal year 26.
But that's the one I just applied for though.
Yeah, it'll come through in FY 26, so it'll
Okay.
come through now.
Benjamin.
Yeah, definitely, I see it coming in after July first, yeah. It'll be,
I mean,
yeah.
what month was that done in?
There's too many physical years I gotta keep up with stuff.
Our pre-events. One, just another one.
There's fiscal fee. Counting and legal.
March and April are the only 2 months that have a $4,000 charge for Together with Veterans.
Yeah, but we didn't.
I thought we paid the whole thing in 1 week.
Well,
Yeah, it's, what I'm saying though is it's not reflected in this, in the cost, which I don't know why it wouldn't be though, because we had to. Oh, because there was no check rate, there was just money transfer.
and I remember
It was
this
just.
specifically because there was a 666 on there,
Changed it.
and we changed it.
Yeah.
Because we weren't going to do it.
Yeah, we were gonna, none of us were like, no, we're not, no.
That's why it says 4,000 up there.
Yeah, yeah.
So yeah, there's no monthly expense in here that hits 4,000.
So we didn't have to include the credit for the TEP grant that we got last year, which won't be.
That would have been. That would be in the 25 budget and our expense report for 25. We're looking at next year's budget for 26.
Correct,
And until we get those grants in, just like I've applied for grants, they're not there. Just because we don't have that money. Once the money comes in, then we'll add it into it and it'll change our accounting.
Okay, see, that's what I was confused about, because I thought everything that we were looking at was everything that was spent in 25.
That's what I thought so too. But this.
It is, that's where I
Yeah,
got.
we're kind of like, well, yeah, we're trying to look at what we need to have set aside.
I had to see what we spent in 25. And pull that over to 26 to say, okay, look, this is what we did, here's where we're at. Now let's fix it and adjust it and make it our new budget.
Okay, that makes sense.
Um,
when did we?
we'll have to go back and Well,
Yeah, because we need to get that caught up before the end of the year. So that we can start the next fiscal year off,
cleaned,
yeah.
yeah, I don't want to sooner, it's, yeah. Okay, so if digging through,
Okay, go ahead.
If you wanna keep going, I'm digging.
all right, well, I need to add this in here,
So physical, oh, together, that's one.
Fiscal agent,
hang on, I messed up my system, I typed in the place I shouldn't have typed.
Yeah, it's like, no, ma'am, you may
I
not.
need my blank now. So this is together with veterans stars. Negative 4,000. This is an expense, it's kind of a veterans expense. And did it under
Tax and license?
this is where we need,
Dues, oh, we need fiscal agent fees.
we need fiscal agents.
accounting and.
We'll need that anyways, because we'll have some for seniors.
Yeah.
Some
Full
for,
health line items, yeah.
Oh, it says fiscal agent there.
Oh, okay.
I'll say it, I'll know what it is. So that now changes. The accounting and legal fees. The choice.
we're gonna have to add in those,
Reflect down below.
well, I know, that's the thing,
County
we need to add in a new line.
There it is. Nice. I won't read that those.
No, it's full. So we did
And let's put together a bunch of the 3,300 though, was that the?
the expense. That's a variety of expenses, right?
That is, right now, this is the symposium stuff, so,
Oh, okay, and then the bus fare
and the bus fares and.
okay, alright, I was thinking.
Because those are isolated expenses
Yeah.
together with veterans kits,
Okay,
and I didn't have a detailed. Place for
Alright.
it.
no, my math just wasn't mapping.
Okay, so we were at,
Well, and I think some of this is gonna change anyways, because right now we're dealing with expense system on the side that is very confusing. And so once it gets put to a point where it's like, we have it, what makes sense to us,
Yeah,
and then we make sure we're referring this over to Betty. Everything's gonna flow a whole lot easier.
so you had mentioned about buffering by like
Adding,
10%. Are we increasing the fee that we paid the y'all?
adding
on the 10% or
like
just gonna-
what we give, not just subscriptions. What was it? Donations and contributions, adding the amount that we give out, so we already budget.
That's under sponsorships right now.
right now it's in there, it's just in a different line item.
We move it over in the future to say that that's something that we're doing for the community.
Yeah, so let's discuss this. So donations and contributions and sponsorships, those are the two line items that are currently in the system. Do we want to keep them separate? Do we want to put them together? So it's the same thing?
Is there something other than sponsorships, other than the 5,000, what else is in there? Other, like, what's the other 2,535? Oh, that was a clean out, that was a,
Right.
that's a zero.
It's the wash. So really, I can zero that out because we won't have. That again. So, yeah,
So far, that's what we've spent. Okay, I say we should merge those two together or make one that says that get rid of sponsorships, because we don't sponsor. We did, yeah.
Yeah.
So I think we should move that to that. It's
So I'm not finding anything.
That's, I,
I swear that we asked Betty to do that.
And I don't think it happens. From what I'm seeing here, I don't think it happened. And so we just never did anything with it. But we're gonna have to go back to minutes
You remember,
and emails and,
I wanna say this. I'm sure, it was around the time we were doing the budget.
Yeah, it was the last time we did the budget.
Health council,
no,
No, it was very interesting.
it was the revision that happened in like November, December.
Yes, yes.
okay, so I'm gonna look back through my emails. So I can't remember if I'm the one.
I mean, she was on at that time. But we were talking revision at that time, and that's when we talked fiscal agents, that's when we really jumped
Yeah,
into the
we
whole
were just-
fiscal
yeah,
agents.
we doing, we were setting up and doing real good.
Yeah. Anybody need anything from the back?
Alright, so now sponsorships is zeroed out. I moved over everything that was a gift card over into contractor. Labor, and again, this will change because now we'll have an employee case to it.
So you have an individual line item for contractor and then an individual line item for employee?
We
Yeah,
will
we-
in the new fiscal year.
Okay,
So yours would be contractor, Carrie's would be employee.
Right, so right now, some of this is cleaning it up, and I'll go in and clean it up again, and then I'll push it back out again. This won't be finalized quite yet.
okay.
I'll say it's finalized it too.
Okay.
Onward. That's
Okay.
gonna be.
Expo expense, we're not looking at event supplies. This is kind of where it gets a little wonky, event supplies. If we're purchasing giveaways, to me, if it's got our logo on it, it's advertising. If we are giving away generic stuff without our logos on it, that's an event expense. And we should never be giving out anything that doesn't have our logo on it.
100%. No, but like say if you need a tablecloth and you didn't have time to clean your tablecloth, you're gonna go
Right,
store and throw it on your table.
yeah, if I have to buy tables and chairs, that's your event expenses. Office supplies.
So back to office supplies, did we budget enough last fiscal year? Do we need to increase that budget?
No, I think we'll be good. I mean,
What's our budget this year for office supplies?
uh,
What's our budget, proposed budget for FY 26 for office supplies?
so we spent 22, but I bought quite a bit out of pocket.
No,
So I think we need to keep it at the 5.
Let's spend it out of the down budget and quit buying shit out of your own pocket.
I did this thing.
I'm a contractor, it's in my contract.
Okay.
At least get a reimbursement.
There's some things I put back through, there's just some things that I just pay for because it's kind of like. But you're going forward, we're gonna pay for the ink, and I'm going back to HP ink and not generic. You're gonna go to.
Right? Oh my gosh.
Okay.
So, that was at what, was that, I'll just need choose?
Is there like real sodas over there? Or where are you getting sodas from?
And there's still another Coke and there's a,
Is there still?
Sprite, yeah.
Did you know those Sprites?
So that is, sit your butt down.
Little mama,
Standing.
little mama.
So I can just run back from here. Not really more, you know.
Which one?
Huh?
Which one?
The one at Pride, no, the scripts that they use, I mean, it smells good, it's just to me, it was just wrong. It's like, well, it's not, so it's.
Another,
Oh, tell me again, what do you need?
25, 5,000 minus 22, 23, and 90 bucks.
5,000, my 22, 23,
About 91.
91.
A 2007, 7, 6, still. Then again, I'll come in here, I just did it this way, so it's easier, I'll clean all the stove.
I was walking now.
Thank you.
So, this last year, we had made a commitment to CASA to pay them a certain amount. Are we going to continue to use that room down there?
Yes.
We
Yes,
have
that's
to
your
for-
monthly meetings from,
Okay,
Yes.
so. When was the last time we paid them? And how much did we commit to paying them every year?
300 is what we paid them. I believe that was what we committed to.
no, last calendar, was it calendar year or fiscal?
No, it was
It was this fiscal year.
this fiscal year, so we
So we
paid
owe them
it
again.
300.
Okay, we owe them again in July then.
Yeah, okay, perfect. I just wanted to make sure that that was,
I think they're a good amount though. You know, it's not like
Because
we
we
go
don't
to
really
raise
go through a whole lot of.
Yeah.
no, and yeah, and I'm sitting there walking, I'm like. We,
But you know, if you compare what,
When you're renting space.
yes, if you compare that, and you get drinks and, you know, so, I mean. I have to stay out of this, because I work there, so but whatever you guys.
So I think that the-
I think they're fine.
We keep paying them, but whatever that is.
I think the 300 is perfectly fine. I just wanna make sure that we're reflecting it on our books.
Are they using it for snacks or it just doesn't?
I mean, I'm not gonna lie, when I'm in that room,
Snacks.
I have grabbed drinks and I have grabbed snacks, so.
Especially when we're not, sometimes when we're down.
Exactly.
Yeah, that's
It's
what
like they're driving out to Dexter's.
But you know, we rent other places and so we just need to be fair. Whatever we do, I think we just need to do it.
Yeah, so if we can make sure that that's in there,
Well, it's already in here because
perfect. So,
that was a check, because I took the check, so that. Okay, post office box fee.
set
Prizes.
fee.
Yeah, that's a set, which I think is 6 months.
It should be the year.
Is that the year?
Okay.
Should be the year.
so 182 and that's just for the box.
It's just for the box.
Are we getting stamps? Are we getting envelopes? Are we getting any of that stuff?
She might be putting that in office supplies.
Uh-huh.
You're buying that shit. You're too damn it, Carrie.
That's what I did.
The trucker, you got
I see like 125
No.
stamps for.
it.
No. Okay, so can we please raise
No.
that $182 up? Can we please raise that up to $400?
Carrie.
I was trying to do something special for everybody.
Oh, I loved it. I absolutely loved it. Don't get me wrong.
So let's see, so let me get you the number here,
Oh, dear Lord.
You lose her.
182.
218. That's why we have budget meetings for you peoples.
Well, and then I know it's a little bit, it's really not a lot to put as, you know, a donation that's gonna be even worth putting on your taxes unless you do a lot to do.
I don't even line item anything.
Well, I.
Sometimes it doesn't even, you know, when you,
That's the thing now, when you look at donations and you go to your taxes and stuff, it doesn't do squat for it.
no, unless you're like really donating.
That's what I felt what I was doing, so that made me sense.
Yeah,
And I
Yeah,
had
no.
all the Christmas cards and ones that my grandmother had, and I collect Christmas cards over the
Yeah.
years, and I just used all those. So that's free.
Well, yeah, it's like I emptied out a restaurant, so like I have a case of little white trash bags. So I don't get trash bags from Alianza, I just go and get them from my little stash because I hate them, and I should never bought them.
You know what, things like that, I'm not gonna say much about, but when you guys pull money out of your pocketbook and you purchase it. The truth is, and if we're really going to do this, we need to do it right. And the truth is that if you spend money. You are supposed to be billing us to get reimbursed for that money. You talked about it this last meeting, and we need to make sure that we do it across the board. We don't do things because of you, we don't do things because of you. We don't do things because of the board or anything like that. We do things because 5, 10, 15 years down the line, somebody else is gonna be sitting in these shoes potentially. And we need to make sure that the same things continue to happen. And if you're spending money, then we're gonna expect other people to spend money, and that's not the fair thing to do.
I think that's what my misunderstanding was, because, as an employee, you can ask and get reimbursed, but as a contractor, I'm supposed to cover all of my stuff.
Exactly.
And so that's where
fair enough, you're right, contractors are supposed to cover their own stuff, but we never have treated you guys like contractors.
I know, but
And that's why we kind of play a back and forth game with it. We charge you for some, we pick up some.
Okay, yeah, and then it all is the monthly health council meeting food that you buy.
Yeah, that's gonna happen.
It's gonna have to stop, you're gonna have to start using the credit card for that, and we need a budget for that.
Yes, so how much do you spend on average a month for food for the health council meeting?
Well, but that's for the big. So we moving forward, whereas I still continue to cook the food? Or are we going forward as if we need to purchase the food, because there's a huge difference in.
I think
Which is why it was easier for me to cook it, because I can cook out that meal for the 20 people for under $50 most of the time. Whereas
Okay.
if I was to buy it, those 9 burritos that we got was $75.
Yeah.
Yeah, and then after.
Well, and that's why, so you took the whole council lunch to a whole new level. She's saying, by pizzas, call it good. No, Carrie wants to go a full.
Yes,
meal,
oh,
And, hey, I'm. Hey, what's the word?
and we can go back to, they get pizza. And my problem with it is that it was, we need to go and ask for donations for pizza, because that was the way it.
Pizzas, every 10 pizzas you get.
Okay, so how many Domino's pizzas would we get?
For the health council, because they won't eat it, 3. And then probably drop down to 2, they won't eat it. When I dropped all the brats and I brought in pizzas, they didn't eat them.
So that's a waste of money.
That's what it is. They're not eating the food.
So that's a waste of money if it's in that sense. So then we come down to one or two things that we need to figure out. Do we continue starting this next fiscal year doing meals? Or do we just budget about $150 a month, which is $1,800 a year, to continue this process going forward? And then if Carrie makes some meals and it costs us $50, then we save $100 out of it. If she doesn't, then she doesn't.
But we pay you the labor to cook it too, though. Yeah, no fairness.
Yeah, because I normally don't leave my house until much later. It'll be fine.
So, I mean, that's just, you really need to kind of look at those 2 aspects.
Want to do, I just want to do what you want to do.
Let me mull it over.
Let's just budget that amount
$1,800.
and do whatever you want, right?
If we save the money, we save the money. If we don't save the money, then we don't save the money.
So everything I dug through, I didn't find Jack about that fiscal agent fee getting charged to get it together with Veterans Hall.
Or get a credit to the.
Or getting credit. I don't remember if that was something that we added on to the agenda.
we
Oh.
when we did our budget.
It wasn't on it, it couldn't have been on an agenda because I do not have an agenda with the fiscal agent fee on it. Saved in my agendas for Together with Veterans, so it must have been a last minute.
All
It
of
was,
5 minutes,
It
because
was
no,
whenever
we
you
talked about it in
coordinator.
2000.
You
And
have,
we had to bring it back into the next steering committee meetings, because we had to do our own budget, so.
and it was approved.
Yeah.
I remember it was
Yeah.
approved.
Yeah.
Because I was the one that was like,
October, and don't go start was.
and I can't remember, I wanna say it was last fiscal year,
Well, if I was my target,
because we were covering.
No, I want to say it's during the budget that she had to revise. Remember, she had to revise the budget for grant writing? It was then that we discovered it.
Before that. It was
But
before that.
that, I think we made that decision around that time, though.
No, it was September, October last year is when we had discussed the 4,000.
But that was around our budget time. Cause we did the budget again.
when did she take over the position?
July 23. Or June, hold on,
July of 23?
2024, I'm sorry, I'm in October right now.
So that was this fiscal year.
Yeah,
Yeah, it was this
And
fiscal
we
year, but I wanna
decided-
say that 4,000 was for 2 fiscal years.
It was to take us back to the beginning of Together with Veterans.
Whatever amount we had decided.
Yeah, because it was a pretty
I have-
amount,
None of my notes.
yeah.
For Together with Veterans.
I have my handwritten notes, but I'll have to go back.
It's always in the office.
This is so much. I think I changed the language because this is the summer.
We'll figure that out,
I'll write this up.
because I know somebody told Betty.
Yeah, I think I've seen an email. I saw an email go through. Write a check.
I just want us to start fiscal year 26 fresh and clean. And we, however we budget in that.
Are you making notes, Carrie, like check to help, for CASA for rent? I mean,
Yes,
not rent, but for a meeting, you're making all those notes though, right, as we're talking?
yeah, I'm sure.
Just so that way,
Because there's line item stuff in here, I'll see them.
okay,
As I go to clean it all up, yes.
okay, okay, I just don't want. I mean, to hurt you, cause we're just kind of bouncing all over the damn place
So 300,
together with veterans.
but it won't be 4,000 again then, right?
No,
No,
You know,
it
it's
was
half
the
that.
previous.
no, it's whatever the amount of the grant is,
It's 10%.
10% of that.
Yeah, well, 10% grant's what, 40,000, isn't it? 39,900, which is why we get 3,333 every damn month.
Yeah.
It's 39,000, so 10% of that is right at 4,000, so it'd be 3,900 and
Okay, so
$3,999.
that's why we did 4,000, so that was only for one fiscal year, but we didn't go back the previous.
We went all the way back to the beginning when we
So
did
it's
this.
just 4,000 plus whatever amount.
It was supposed to be a larger amount.
It was all in one.
So yeah, the 4,000 is what just pushed this, so this is the.
You're correct,
Yeah.
you're correct there.
Yeah.
I think we ended up with the sixes because we divided that 4,000 out by month.
We did, because we went back all the way to May of, it was May of 23. Is when we
Yeah.
first started it.
23.
Okay, guys, $5,000, we're good with office supplies, PO box, we added that. Prizes and gifts,
2 years, that's why.
can we move prizes and gifts also to donations, because that's also giving to the community. For attending our meetings and, okay, can we move that over as well?
Prizes and gifts underneath together veterans, what was that cost? It was 1,000. That's fine. 1,061.39.
Visa cards, that's the monthly meetings.
That's the one I wanna go to, donations. I think prizes and gifts for the expo, I don't know that, I think it should go, because that's cheaper.
It's this. That was the certificates I bought that should go into office supplies, which is gonna adjust that. Count. Walmart, see, this is the expo.
Expo, you should probably
Venus prizes.
Yeah.
That's those six prizes.
Okay, together with veterans, that's the Christmas baskets, the symposium awards. See our annual ones.
What is that?
Was there any plaques or anything that you did at CRM? T-shirts?
T-shirts. For the symposium.
Let's change that.
Supply? Yeah, or some sort of event.
Here you go.
Yeah.
Albertsons, that is the meat, the turkey ham
Okay,
for the Christmas baskets.
that's good. That's, so none of those donations?
That's donation,
That would be donations.
donations and contribution.
And then the other two would be donations. Yeah.
Yeah, because we gave that stuff.
That's what you
Yeah, because
We can leave it where only Expo gets that prizes and gifts category, because it is prizes.
yeah,
So the $25 gift cards for the health council meetings.
Donations, contributions.
this is rigged. I never win.
I agree.
You know what? I won once and didn't even get what I was promised, so.
I'll give you a Sonic card, I got.
Yeah, I'm not worried about it either way. I just thought it was really hilarious because they're like, you're getting this, and then all of a sudden they hand me another gift card, and I'm like,
What happened?
okay.
Alright,
But I blame.
We have presents and gifts, okay, so that cleared that one out, meeting expenses.
Which I honestly, meeting expenses and together with veterans expenses, we need to clean those out and really categorize them.
Eating expenses, was that, we did
Yeah.
the, for health council meetings? Oh, what is that?
Yeah, because we wanna have, well, team meeting, food, daycare,
But
Uh,
council meeting expense.
daycare.
Anything that's expensed for that meeting specific, for any meeting.
With veterans,
So, yeah, I was.
And then for our general,
they were general, ours is 300 cost of meeting room.
that's fine.
We did Dion's once. And then we went to the Kiwanis event. Where we were at the table. And then the sales coffee, you were gonna go to the mayor, but you know, at the mayor.
Yeah, I should under donations and contributions. Um,
Oh, and
so the meeting expense, it carried over because that's what happened last year. I would agree that the $300 to CASA stays at a meeting expense, or do you want to do it a donation and contribution? We're giving them, we're not renting the room, she's not charging us anything for the room, we're doing it because we use the supplies that are in there, we're gonna kind of compensate that, but we're donating that. to
Yeah,
CASA.
I can put under donations. That's a whole nother number. Look, when we go out and. We're technically donating the money.
That,
You know, that's exactly what we're doing. We are not, and so if we go out and we say, hey, so we did. You know, we had $10,000 in donations that we gave last year. I'm just throwing a number out, but if we had $10,000. Look, technicality, black and white, as long as it's a donation and we're not getting invoiced for it, keep it under there, because that's gonna help us. When we go out and ask for more money and we do all of these different things and stuff. That's what that line item is for.
do you think it'll go against us? They're gonna be saying you've given too much money out.
Well, that was what, okay, so because technically the general fund is funded through DOH. DOH, the meetings that I've sat through.
They
when-
say no food.
They say no food because I got thrown into well, the health council gives food and this, and that's why I went, no, the health council doesn't, Carrie does. And then Joanne's like, oh, I'm like, yeah, don't sit here and say you do this.
Well, we do, and we will, but I mean, we get other grants. I mean, we get fiscal agent fees. That could be coming out of that.
Yeah,
Yeah, so we're not
So
using
it's-
that grant.
Yeah, and that's,
yeah, but I just want to clarify since
Oh, yeah,
I was
budget
under the gun
clearance,
and
they say that. They wanna throw.
You just say, oh, no, we get 4,000 a year from Together with Veterans for fiscal agent fees, and so we use all donations and food.
Well, we can say we get other funding that's non-restricted funding.
Yeah.
You know, so, yeah, at the end of the day, you know, I don't want it to hurt us that we're putting all this money under donations and contributions when we're applying for grants and saying, we're giving our money away.
Right, and we'll have a problem with that when I'm doing the grant pieces to it, but if I can sit here and go to, well, the fiscal sponsors.
Fiscal
fees, that will be a whole different thing and we can utilize that, but if I go out and say, hey, Eastern, you know what? Why don't you kick me 4,000 to the health council every year because we're helping you, blah, blah, blah. Then now we have a budget where we can do something, and it came from the community to the community.
Yeah, and when we start doing fundraising, it's gonna be a whole nother level, because that's totally unrestricted.
And they don't know, and technically, even though the Health Expo, we count as a separate entity, it is not. It is a health council.
Initiative, yeah.
Yeah, so we keep the money separate just because it's a separate program, but it's not. So if anybody was come back and say anything, but we do a fundraising. We do it through the expo. And that
Because
is
we
our big-
always have surplus,
yeah.
so we can justify it in that way.
so it might be worth in that instance, again, and honestly, for. For the health council meeting expense, I'm less concerned about.
Yeah.
It's the Together with Veterans, and the expo. Meeting expense. That was like, we were just throwing things in.
Yeah,
It was literally a dumping ground for
Yeah.
everything, and that's where I'm like, we need to categorize this.
I think at our next steering committee, together veterans, we can go sit down and look at what we did and break down that in our budgeting. That we were budgeting specifically food for steering committee, food for team, food brands.
It might be a good
Yes,
idea
because your budget should look exactly like the line items, just like this, just like the expo.
Well, these are ones that, yeah, just,
First to know that because when funding does cease, you'll know what it's gonna cost you every year. For those line items, and so that way, if we need to cut back or whatever, we can start doing that.
So, and if we need to, I mean, if it becomes one of those issues, we can just go ahead and do a 10%.
Well, that's
to the expo. Just like we do with Together with Veterans.
Well, let's not do that because it's a tight year, but we'll keep going with it.
Yeah,
but no, because after the money spent, it was 10% of the donations that would get in, right?
It's donations or grants or anything like
Yeah.
that.
Yeah,
So, if we get. A certain amount, then. The health council gets 10% of that.
Yeah.
so then the grant that we got for the bus fares, we should have got 10% out of that.
No. No, I don't think so because. Yeah, let's
Honestly-
just kind of keep it a basic thing so we can keep these programs running.
Well, yeah, because again, that's still, okay, so the difference is Together with Veterans is still a health council initiative. Which is different than. Caring for Seniors, who has their own board, which is different than SHU, who has their own board.
Well, how she kind of-
that should,
Also, yeah, you're.
And then the behavioral health, honestly, will keep it separate, but they don't have their own board. It's gonna be an initiative of us. So they'll be part of us, even though we'll charge them a fee, just because. But it'll still technically be our budget.
Yeah, I think the reason that the health expo is not being touched. Is that we don't know from year to year what kind of sponsorship we're gonna get, so we need to save money in that pocket of money. For a rainy day, so we want that to happen every year, that's kind of a priority, and so. Like, we're facing a really odd year, right? We had a flood, we had a fire, we can't use our same place, like all these reasons why we need to save that money in there. And everybody else, I think we can charge a 10% fee. And we'll keep it that way, minus these small things, because I think that again, Together with Veterans funding is gonna go away and we need to save that
But
money.
again, it's still our programming.
It is ours and we're gonna make sure it works.
Yeah.
Okay, continue, sorry, we digress.
Okay, I don't know where we were.
We were at
Meeting
prizes, okay. Meeting expenses, good. License,
Tax and license, this, we had to pay the tax fees,
Secretary of State fees,
$50 and then plus whatever
late fee,
late fee and blah, blah, blah. That's what that crap is.
okay.
The license, I did not renew the city business license because when I talked to them at planning and zoning, they're not required to have a business license.
Okay,
And I said, okay. Bye. And so I didn't do one.
is that true?
I don't know.
that's a good question.
According to the director of planning and not planning and zoning, oh yeah, it is planning and zoning. The business office over there. Because I went to go find out some stuff, so,
Okay, all right,
and until they change it,
okay.
which I
So
think
that taxes and license, is that an every year expense?
the $50 will definitely be an every year expense.
Okay.
We shouldn't have the additional because,
Okay.
Yeah, I'm fine.
Telephone,
Well, that was taxes.
and then the telephone is at the end of the year, you just say taxes.
so yes, so this is our office lines, the 3CX.
Is that for a whole year?
That's the whole
Okay.
year, and then this is the
Sorry.
Cricket lines. And the Cricket's got 2 cell phones and 2 tablets on it.
I thought we were gonna discontinue.
We have to keep at least the 1 cell phone on it. I hadn't discontinued until we got everything.
Okay.
The other thing to look at too is a lot of times with these companies. If you have 3 or 4 things on it, it's gonna be the same or cheaper. Than if you have 1 or 2 things. And so that's something that we probably need to look into before we officially decide to cut stuff.
Okay.
Because that could affect our bottom line across the board.
Well, and the tablets, what it is on the tablets is the internet.
Data,
Right, so if we go back out to where we're going into the communities where
We
we're
need it.
doing, we'll need them.
Yeah, but the other cell phone, do we need it?
I've never touched it. So I don't wanna carry two phones, so.
Can the other?
We need to keep the 211. What is 211? It's the other one.
It's the other one.
And I think that other one we don't need. Nobody even uses it. But I don't know what the cost is, so if we keep paying or not.
I don't know, it's $110 a month is what we're paying for the 4 services, so I would assume that it knocks off one. But yeah, I can,
If it doesn't change, then leave it.
Leave
If
it, yeah.
does change, then drop it.
If we get a reduction, yeah.
Cause if we get that, when we get that CSET person. That might be, cause there's an app for the 211 calls are coming in, right?
Yeah.
Yeah, so could have the app on one phone and the other one, well, no. That won't be here, sorry.
if we have to
Another
go back to
person-
using, because it's still ringing through the cell phone, the 211 is still ringing with the cell phone. It's just porting into the app. So if we need somebody who doesn't wanna put the app on their phone, they can take the cell phone, and we still all see where it's ringing.
Okay,
And it's just like if, say, if Jennifer wants to take the 211 line, we just activate her in the app so that it can.
I already have.
You just don't get the 211 calls.
But that phone could be useful for like whenever we have the sign up for the board members to take over.
Yeah.
So
Yeah.
it might just be beneficial to still keep it.
Well, we have to keep the one.
No, the phone one.
well, the one is already programmed for 211, so whoever would do it would take that 211.
Yeah.
Oh.
We have the 211, but and then we have the other.
There are two
Do we
different
need the
phones.
other?
No,
That's what we just talked about.
Like, we don't need the other deal.
Now,
Does that still include, tablets?
The two
Yes.
tablets.
Do we need the 2 tablets of service?
going out in the community, yeah.
If we're gonna go back out into the community, and I feel we need to be in the community.
Maybe this year for Health Expo, we could do a survey and have those tablets on them for a surveyors too.
Right, or maybe you can use them at the symposium.
Yep. For any survey,
Because we already know that the paper surveys didn't do. Like we wanted, we're just doing.
it's really nice, enter a prize. Fill out the survey.
Well, that's the thing is, we may wanna look at building ourselves like a survey QR code
We did,
too,
did.
and they still didn't do it.
No.
and it was tied to
Prize.
a prize.
But at the expo, people come to your table and they can see the prize, you wanna win this prize, so it's survey. We were pretty successful with that one. For the behavioral health grant,
Yeah, you were alone.
they were filling them out like crazy, but
They do a lot for money.
you do a lot. So
And
this
it was gift cards. It was.
Yeah.
Yeah,
This
so
was the aquatic center, which they never even picked up, so. You know,
you should give it to me.
Hey,
My knees are shot, my foot is shot. Can you flip my?
Well, I think during that time though, didn't they have all that black mold crap you clear with, shut them all down anyways?
they're in the.
Well, they finally got it figured out.
the rent for Alianza, as far as we know, will stay at the 200.
And just talking about rent, guys, I think that the one thing that we did talk about during one of the board meetings is that if this place goes down, like sells or we have to move. We have to find another place, but we only pay $200 a month for rent.
And
So-
we'll not find another place.
I think at my building, you might look in to see if there's any things that.
Well, we used to be
Mine
in-
is 400 a month.
Like, that big space.
Thanks, I think.
We used to be able to pay $200 a month
Oh.
space.
But it's two offices, I mean, like.
Tiny little
Like
room.
it's big, it's
Nice.
like this,
Yeah.
yeah.
All I can tell you is I do not want to share office space with.
We're not gonna do that. We're not gonna do that. But just so you guys know, right, like that's a possibility and we would
Yeah.
probably. I don't know.
But there is somebody that I know that is looking at purchasing the building and he's kind of really excited about doing it, so. And it's a 2-year lock contract with Wells Fargo. In here.
And if we get more money, like if we get more money, like in opiate settlement funds or a budget line item, we could afford maybe something better. So
Towards our own space.
it's our own space, right?
2 offices in a conference room where we can have our meetings there
Right,
with AC.
right, maybe somewhere that it would, so anyways, I just want us to know that, so that way if that happens, we need to. find a place.
Registration fees versus training and education.
See, I would.
There's nothing in registration and training and education. There was Sonia.
She did that contract.
Employee training.
When we have the training for QPR trainers and stuff too.
I didn't see a cost in there for that though.
Oh.
I think this is
Yeah.
the reimbursement of when I went to Albuquerque for this Santa Fe for the state meeting.
I said we need it, we need to budget for, yeah. Because if we're gonna continue to do ongoing professional education, we need some kind of budget for it.
Are we keeping both line items?
Yes,
So registration fees will be.
Or anything that you would sign up for that would cost you to attend, like say, for example,
Versus.
so registration,
So that could be like Danny said, for a conference, you're gonna register for a conference. And need a hotel and all of that. Versus a training.
Yeah, like our
Training
so,
is gonna be a different,
so like the NACBSO training that we have to do every year, we have, it's a $400 charge. No matter what, whether you do it in person or whether you do it virtually. But then in addition to that, you have these other things that you can register for that are no fee, that are like dinners and luncheons or whatever.
what I don't see is the mileage that would cost us to send you to. These training, and that could go under training and education. Or we could do another line item.
well, here's another question for that then. Let me get this pulled up.
Remember, I started the conversation with my shower thought.
Yeah,
What?
that's what you get for
Shower thought was,
I thought they were
Policy.
policy thoughts now.
no, it's both. It's usually about the same.
So
Proper policy to serve.
in the state of New Mexico, we are technically allowed to choose our reimbursement rate when it comes to sending employees out.
Mhm.
Their recommendation is 70 cents per mile.
Shit, the state is at 40.
Right now, well, I think the US reimbursement rate is 67 cents per mile.
Well, that's where it's different at, because like one of them is like extremely low. The school district was below everybody else.
Yeah.
Well, I wanna say state is in the 40s.
Which you guys
go with the federal.
federal rate,
Mhm.
it's fine.
I think it just
think
needs to be
federal.
something that's just standard all the time, and
So
we don't have to worry about ever going in and reassessing it, because they'll do it on theirs with their class.
Automatically
Yeah.
federal rate.
Yeah, I think that's a good one, because that's what we use at CASA, it's the federal.
Which is 67 cents.
that is,
Or is it
business is 70 cents per mile.
70 cents. I don't know. Obviously, but a lot of, I don't
It increased 3 cents from 24.
know, okay.
Really?
So I just say add a line item for mileage. At least we're budgeting for some kind of training and education. It could
But
go under
in separate
registration.
line item for mileage?
Yes,
Yeah, you would want to keep a separate line item for mileage.
Okay.
I would just say do a registration fee to be on the safe side, just to put some money to budget in there in case there's something that comes up that you guys wanna, that you need to attend. Maybe like $500
For
registration fees.
Frontage.
I was wondering what the heck that was.
Yeah, it's a little midget thingy. So
It's like a
driver.
3D printer,
Yeah,
way cool. Well, say 3D printers are pretty awesome. It's very unusual too.
Yeah. So how much
that's the rule.
do we want to put in mileage reimbursement?
Let's up to at least, she did $500, was that just travel? That $500 or was it lodging and travel?
It was lodging and
Mileage?
my gas expense.
Oh, not mileage.
No, because nobody's, and so I just said, okay, well, it cost me this much to go, here you go.
How about we do mileage? Set up, another 5, I guess.
I think so.
Yeah.
I don't have a line item for it, so I'm gonna have to put it under registration fees for right now.
That's fine. And at least if we don't use it next. Planning for FY 27, then we know, but yeah, at least we'll have something. Yeah.
Yeah.
Well, and when we're doing policies, you'll need to put in there which ones are Zoom policies versus in person.
Okay.
I have a tendency, I prefer in person,
Oh, that's
because I think I get more out of it than.
Well, it's, when we do the, I mean, you guys notice with the travel policy anyways, there's a per diem that they get each day. You know, for those sorts of.
set amount.
Set amounts and stuff, how, you know, depending on breakfast, lunch and dinner, like all of those things, so it's, yeah,
And the receipts you have to have,
everything.
yeah, itemization and the one showing that you paid it, some blood marked on the lines.
Ultimately, when it comes to receipts, I think that if you have a receipt that shows
Oh.
what was paid total, and then like what was just, that's all that matters.
That's
Yeah,
why I zeroed it out.
no, it's like, just, they don't like it, we go,
Okay,
okay, buy alcohol.
So- anything else, guys? Do you want to scroll down to the bottom line and see how much damage we did?
We're to,
Like 2,000.
We're like, man, we're spending all our money.
like it.
Okay, any thoughts, comments, concerns, suggestions? Dan, Sonia, I'm sure you guys are passed out.
So.
No, we're
I do wanna-
I'm still here.
Anything, any thoughts?
If we end in May of this next year for Together with Veterans, we will not be getting the full $39,999.96. So we need to
Budget for that.
truly budget for that, so if we do,
Thought it was that much per year.
But it starts in May, not July.
yeah, so it.
It'll end
so-
in May and then there'll still be 2 more months.
So April will be the last month that we'll get, right?
Yes.
It's ultimately April will be the last month that we get.
Of 26.
Okay, yeah,
Yeah,
so
I'll put the invoice in for April.
it's gonna be $33,333.30.
33s.
3.
53.3.
One's better. I got it.
So, and then this undistributed is when we have a carryover, because I have to have a zero budget. Undistributed will be all the carryover.
Okay.
So that's how that will zero out.
Okay,
But the goal is that when we're looking at revenue and expenses, we're looking at just what we generate in the fiscal year. And not rely on any money that's floating carryovers,
okay.
with the exception of the expo, because the expo is different because it's a weird carryover.
Expos is special. All right, any other thoughts, guys? We got through this. Not too bad, not too bad. Let me look at my notes really quick. Okay, so some follow-up that we need to do is, I gave you guys the crisis line number. DOH MOU is on hold. We need to schedule a special time for travel policy, other, policies.
You didn't give us the crisis line number.
I did.
She sent it out in
Basic.
basement.
Oh,
Maybe she paid attention.
I've been busy.
See, so when do we want to schedule that? I don't want to leave without scheduling something.
We said after expo,
After
August.
August. When is our board meeting in September?
Well,
But don't you need to put that done before July?
Meeting as the 25th.
It's fine.
it's during the first couple months, we're not gonna have anything truly popping up. It's gonna be a huge, huge issue. So
Sorry, I was just asking. Yeah, we were saying earlier about something else had to be done before July 1st for the employees.
So August is. I mean, and this is just throwing this out there. What if we just do it after the community meeting on the 16th? The four of us will quickly sit down.
16th of August?
Yeah, because we got because we got the steering
Is Jen gonna be
committee.
burned out though because of the expo?
And I'll have another, well, we can train, but I don't think I need to be a part of it.
No, I think that is ultimately probably the four of us. need to sit down and really go over the policies, and then we can bring it before the board. And we can bring it before the board, because our when our executive health council meeting isn't that is it the 21st or the 28th? I don't think it matters either way. We would be before that too, so we can bring them all, yeah. So you could send them out before the board and they could read them, and then we could get a final approval on the 28th.
Gotcha. So when is the expo?
The expo
second-
is 4th
August 2nd.
or August 2nd. I'm saying, do you want to do it August 2nd? Because I was thinking the 16th.
No, I'm just,
Okay.
I just wanted to know the date. And then so 2 weeks later, the 16th, we meet for
Together with veterans.
policies.
Community steering committee and then policies.
So make it extra long meeting for us, or you'll.
It'll be a little extra long meeting. I don't think it's gonna take,
True.
I don't think it's gonna be hugely long.
What time do we start with together with them?
At 12,
At noon?
Yeah,
Yeah.
and it's over by 2 because we do the steering
Do
committee.
we meet at 9 then? 9 to noon for policies?
I'm fine with that.
Okay. 9 a.m.
Here again, or?
CHC, wherever together with veterans meeting is where we'll meet.
I'll do it.
Oh, team.
You don't have to be there at 9.
Yeah, it's really just gonna be,
If you want to, but you don't have to. So we're gonna do a travel policy and any other policy that we can think of. Let's say this will be a catch-all in case there's anything that we haven't done regarding the switch over. So if there's any extras regarding outliers, maybe if there's anything we need to look at again with the budget, we could do that. If there's anything outliers,
And what's that date on that?
August the 16th at 9 a.m. Before the Together with Veterans. Vetting deadline is June 30th. Carrie, please let us know if there's something that the board can do to support you with that.
If we can get, a helper in to help with the vetting out. It's what's better.
Why don't you send the board the spreadsheet and
And give you access to
Survey
the
monkey.
spreadsheet.
so that when we have time, how about the board
Yes,
start making calls
I think we
and
should,
doing the vetting?
and just give us a little instructions, because I just want to know what to do. 1, 2, 3, do this.
Well, and
Some
then
of those
Survey
ones
Monkey,
say, cause I can bark all over the place and that won't be good when I.
Well, the Survey Monkey makes it easy because you're just gonna go through the questions.
yes,
Okay.
and
One
that's
at a time. And that's all you do. Really, the spreadsheet is just to get who you're calling.
right,
Okay.
because it can't be done on
You can pick
paper,
one of
because we
those.
have to keep track of it electronically, because I need my intern to be able to. Sam,
To do that, okay.
can you put an extra column so that, like at the end or something, so that if,
one at the beginning, so you can mark off it's been here.
yeah, so that we're not calling them 5 times?
Yeah.
Yes.
Yes.
So like, our
Yeah, so we can just pick up.
And I so that way, as soon as there's an item in it saying that it's been done, that it highlights it in color so that you can just automatically look at it on color code.
Okay, yeah. And then the last thing is we're gonna go back to our offices and look for that note for fiscal agent fees for Together with Veterans and kind of identify where the heck that went and what happened.
Yeah,
Retro.
because I swear that one of us told Betty
I remember the conversation.
that needed to be switched over from Together with Veterans to Health Council. It needed to be out of Together with Veterans, and I'm not seeing it in our side, so I don't know about that in our side or.
Which is perfect, because that'll help us narrow down what the heck is going on.
So it just in basically, if we could just report back out sometime next week so we can get that issue clarified. Is there anything else that we need to talk about before we adjourn?
My birthday party. was fun. Before you go into that, let me. Because I don't know, the New Mexico Symposium on Health.
Huh?
Has a conference June 4th and 5th, June 3rd and 4th, it's 2 days right there in Albuquerque. Is that something I need to register to attend to?
Is that the one for the engagement of youth, or is that something different? Can I see that?
This is what they sent me. The youth mental health needs one I'm already registered for, but that's here in Roswell.
And it's in August.
And that's that Youth Rising in August. And Dan's over.
I think it should, I think it's topics that, of things that we do, Carrie.
Yeah, I have to back out a little bit.
Think it would benefit the work that we do and it would help to kind of continue to shape and frame what it is that we do here, but yes, it would be.
Okay.
I agree, I'm just going to do the reminder of. Bill properly for this place.
Use the card, any way, shape or form to pay for your hotel, but. You know, that way you're getting the most out of that and then bill us mileage.
Okay, no, not in
Where
your
is it at?
forms, you don't need to take a big feet out there.
I don't know, I'll have to pull it up to see. I
Yeah,
think
get out.
this is tied to installation.
Yes.
It's tied to
Group
them,
Did the, one of the grants,
the tobacco sensation
this,
grant.
yes.
Because they also had sent out that they are doing something that's got a little blood pressure cups. $1,000 to do blood pressure or something and to buy the cups. I don't know if that means buy one cup and you get to keep whatever's left of the 1,000, or you have to buy 500 cups to distribute and we'll just give you graciously $1,000 to help offset. And I haven't dove deep into that one to find out because I don't want to buy cups for everybody.
Well, let's find that out, that could potentially be something where we just have. An extra booth at the expo and say, come get your blood pressure. checked."
Yeah, if it's buying one and we're doing it, then that's,
Do it.
yeah, I gotta reach out to Garcians, but I wanted to ask about that.
Be a good thing to have at the expo is a blood pressure check station.
How stressed
Talk
out?
about it, huh? So each one of us jump to go over there. Eastern does it, yeah.
Oh, okay,
Yeah, that's one of the very few
do it.
engagement
doing
items that they, screenings that they do.
Okay, anything else, guys? Anybody online? Dan and Sonia?
I have nothing else.
No, I'm good, thank you.
All right. You wanna announce your party before I enter?
No, it's fine.
Okay, meeting's adjourned. It is 2:04, 2 hours early. It's because you guys did the legwork. Thank you, Carrie and Rick, for really narrowing down that budget beforehand and because we'd still be here. Yeah, vacuum it out. Yeah, thank you. Good meeting, guys. Good meeting.
Alright,
I'm gonna write that letter and I'm gonna send it to you guys for some editing, just to make sure I'm saying things correct.
sounds like a plan.
You will need to make sure that health council items get returned.
Yes, the tech and what else does she have?
Oh. That's something we may wanna
Swag.
put together.
Yes.
It's not gonna be something that's gonna, affect us a whole ton at this moment. But we probably want to put together a form that checks out what items they take, so we know what items are going to return. Save ourselves some of these headaches. Sure.
Yes. No, seriously, I'm not finding out later that
Our stuff is being handed out at
Yeah.
another location.
So was that a valid